Additionally, before we begin, any members of the public that wish to provide oral testimony during today's meeting, please review the instructions posted on the Clerk of the Board's webpage. I would remind members of the public that have requested to speak to wait to dial into the meeting until the item is called. With that, I will now call the roll. Supervisor Anderson?
Here.
Supervisor Lawson-Remer?
Here.
Supervisor Desmond?
Here.
Vice Chair Vargas?
Vargas here.
Chair Fletcher?
Fletcher here. With that, let's move to our invocation, pledge, and proclamations. If everyone will please stand, we will begin with the invocation. The invocation will be delivered by Pastor David Tran from Table, San Diego.
Let us begin. If you feel comfortable, I invite you to open up your palms as a posture of receiving and surrendering what God may want to give us. As San Diego sits on the traditional homelands of sacred Kumeyaay, we also honor and pray for the Kumeyaay people and other indigenous caretakers of these lands and waters, the elders who lived here before, the indigenous today, and the generations to come. Our God, our source of life and being, you call us into a collective communal reminder, a reminder of who we once were, who we are, and who we are becoming. Remind us then, God, that we belong to one another and are bound up together in hope, in despair, in trial, and in liberation. God, remind us of our failures, both past and present, and to hold ourselves accountable to the greater good. May we also offer grace to others as we ourselves have received grace. Remind us that we are unconditionally loved by our Maker, made in your image. God, remind us of our social location, that we may always use our privilege and power to serve others, and our humanity to connect and empathize with others. Remind us that love of neighbor is the compelling command to work towards the well-being of every single member of our community, even those with whom we vehemently disagree. God, remind our souls to go beyond any performative acts to please others, even ourselves, and instead to keep up the good fight of justice, as you teach us that our society is best defined by how it treats its most vulnerable. Remind us to commit ourselves to working for justice and exposing injustice, not only for ourselves, but for every person, even when the cost may feel too high to bear. And lastly, God, remind us to mindfully resist the evils of violence, of racism, of hate, of discrimination, and of silencing. Mighty God, we pray for a supernatural courage and healing of all healthcare workers, the sick and the mentally ill, and the most marginalized in San Diego. We pray for an embodied compassion and kindness to mark all San Diego elected officials, their discussions, and their decisions. We pray for hope, because hope sustains us, keeps us, protects us, and drives us forward. Creator and sustainer, hear our prayer. Amen.
Thank you. The Pledge of Allegiance this morning will be delivered by Lila Violeta Flores. Lila, thank you so much for joining our meeting today, and we are honored to have you lead our Pledge of Allegiance.
Good morning. Thank you, Supervisor Fletcher and Supervisor Vargas, for inviting me. And good morning to all the supervisors. Please place your right hand over your heart. Ready, begin. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you so much, and thank you for joining us. We'll now proceed with our proclamations. I'll present the first proclamation honoring retiring Balboa Park Ranger Kim Duclos. Today, it is a great honor of mine to be able to recognize and honor a true San Diego public servant. March 25th will be Balboa Park Ranger Kim Duclos' last day of work after diligently serving in our Crown Jewel Park, Balboa Park, for over 25 years. Ranger Duclos' love for and deep knowledge of Balboa Park is so famous that he has well earned the nickname Mr. Balboa Park. It is hard to summarize his career in the amount of time we have today, but here are a few of the highlights. In 25 years, he has led over 2,000 tours for school children, members of the public, and dignitaries, has been featured in a comic book about Balboa Park. In 2013, he was the first city employee to receive the Gertrude Gilbert Award from the Committee of 100. And in 2020, he was the second ever recipient of the Lifetime Achievement Award from the Friends of Balboa Park. He even performed the role of park ranger in a play at the Old Globe Theater celebrating its 75th anniversary in 2013. And in 2015, provided the narration about Balboa Park with the San Diego Symphony, celebrating the 100th anniversary of the Panama, California Exposition. Over his career, he has always been willing to help in other parts of the county when he was needed. He proudly assisted both the Cedar Fire in 2003 and the Witch Creek Fire in 2007, helping with structure protection, transportation, pet evacuations, and emergency shelters. Balboa Park and the entire San Diego County will miss Ranger Kim Duclos. It is my distinct privilege, along with the entire County Board of Supervisors, on the 16th day of March, to officially declare this day to be Kim Duclos Day throughout San Diego County. With us today is Mr. Balboa Park himself. Thank you for joining us. Congratulations, and we welcome you to share a few words.
Oh.
Uh-oh, I can see you. I can't hear you. I think your Zoom's on mute. There you go. Now we got you.
It takes a village to unmute the ranger here. I couldn't be more honored. Thank you so much. I don't want to take too much of your valuable time. It's been such an honor to be a public servant here, as you mentioned, in the jewel of this park, and it does belong to all of you, all of us. I appreciate all the work that you do on a daily basis. I appreciate what you've been doing for COVID vaccinations here in the park. We've been trying to assist with that a little bit too. It's just been such a pleasure and the honor of my life to be a public servant. And I would just love to thank my family, my mom, dad, sister, my lovely son, and my wife. They have been wonderful. And thank you so much. It means the world to me. And I hope I can continue to come back and volunteer and help out any way I can. Thank you so much.
And I'll tell you, if the city won't have you back volunteering, we got some great county parks. We will gladly take your services.
Thank you so very much for this honor.
Thank you, Kim. We appreciate public service and particularly yours. So thank you very much. Our next two proclamations will be brought by Vice Chair Nora Vargas, one honoring Latina History Day and the other honoring American Red Cross Month. We will turn it over to Vice Chair Vargas to present both of her proclamations.
Thank you, Chair Fletcher. I am very excited to present this proclamation honoring the American Red Cross of San Diego and Imperial Counties for the work that they've done serving both the communities, covering more than 3.6 million people, especially over the last year during the pandemic. Last week marked 1 year since our lives changed during this difficult time as everything began to shut down. Red Cross stepped up and encouraged blood donations, and they've since trained hundreds, if not thousands, of volunteers who donated their time to help those in need, and they've never turned anyone away looking to help or assist others, no matter anyone's background. During the pandemic, families across the county were dependent on local Red Cross volunteers every day for emergency support, providing blood to our hospitals, offering assistance to military service members and their families, crisis counseling, and so much more, providing food to families in need and everything they needed. So in 2020, Red Cross trained volunteers providing mental health care and spiritual care to over 50,000 people during the pandemic. They provided emotional support to anyone who needed someone to talk to during this difficult time, especially grieving families who lost ones to COVID. It's often been said that during America's worst time, it's where you'll find Red Cross volunteers and their best giving back to our communities in need. Last year, more than 70,000 people across the country became the new Red Cross volunteers, largely to support urgent disaster and essential blood and plasma donation needs. Today and this month, we are proud to honor the work of our American Red Cross staff and volunteers throughout our region by proclaiming the month of March as Red Cross Month throughout San Diego County. Now, I'd like to turn it over to our friends at the Red Cross.
Well, thank you. This is wonderful. On behalf of those 2,000 dedicated volunteers in our county and our small staff and our Red Cross board, I want to thank you, Vice Chair Nora Vargas, and all the county supervisors and staff for this recognition. We're thankful for our strong cooperative relationship with the county supervisors, the County Office of Emergency Services. We work side by side with that staff and other county offices and partner nonprofits that work so closely with us. The whole team at the American Red Cross looks forward to continuing to support the people of San Diego County, bringing help and hope to those who need it most. Thank you all again. We appreciate it.
Thank you so much. And I wish I could give it to you in person, but we'll send it over to you, all right? All right. My next proclamation is really near and dear to my heart. Today, as we celebrate Women's History Month this month, I'm really honored to be able to present a proclamation in honor of the 30th Annual Latina History Day and recognizing HOPE, or Hispanas Organized for Political Equality, an organization that is near and dear to my heart and has made so much impact in my life and so many. I want to share with you a little bit of a story because it was about 23 years ago. I was working in Sacramento and I was invited to participate in Latina Action Day with HOPE, which was founded to focus on ensuring political and economic parity for Latinas across the state. So I participated and then I was later invited to join the HOPE Leadership Institute. At the time, there were no Latinas from San Diego who had been engaged with the organization. And I'm proud to say that not only am I a graduate from their 2001 Leadership Institute program, but I also became the first Latina board member from San Diego, California, and the first board chair as well. The organization since then has developed an international binational program, the first of its kind, and I was proud to be part of the inaugural class. As always, I say that I've been the first at many things, but I've always made sure that I was not the last. And as a result, we've had numerous Latinas from San Diego participate in the leadership program, including most of my staff. So to this day, I continue to participate in the organization by training Latinas across the state on how to get politically and civically engaged and how they can get involved in the political process to run for office and make sure that they have a seat at the table. And so today it's my honor for me to proclaim March 12, 2021 as the 30th Annual Latina History Day, not only because of what the organization has done for me, but for what the organization has done for so many women across the state, but for the advocacy as well on behalf of the women who can't attend the conferences or can't take part in the leadership program, and on behalf of the women who don't have access to these opportunities. So together, we advocate for healthcare, economic parity, and education, and in all the issues that really impact our community and our families every day. This is why Latina History Day and HOPE are so significant to me, because of the amazing work they do throughout the states. Since its inception, Latina History Day was created to rewrite history, to uplift our girls, to celebrate achievements. And we usually do this in Los Angeles with over a group of 1,000 supporters. And we invite and honor Latinas who have paved the ways for so many first, unfortunately still. But we are happy to honor them. And although we couldn't gather in person this year, I am thrilled that I can proclaim Latina History Day and honor HOPE because of what the organization has meant to me and to hundreds of women throughout our great state. I want to say that without the guidance and support of my HOPE hermanas, I would not be here today as the first Latina, the first woman of color, and the first immigrant to serve on the County Board of Supervisors. They are a nonpartisan organization, but they're all very engaged civically, so I want to make sure I say that. But I want to mention that several of my executive team members, as I said, are alums of the HOPE Leadership Program, and I hope that more Latinas from the County of San Diego look to participate with HOPE and engage in the different efforts from Latina History Day, their leadership programs, and other initiatives championed by the organization. Lastly, I just want to say a special thank you to Helen Torres, the Chief Executive Officer of HOPE, who is joining us here today, for the amazing work that you do every day for our staff, for your staff, and everything that you do to provide innovative programming that has served thousands of Latinas statewide. And I know that you will continue to touch the lives of so many more. It is my honor to proclaim Latina History Day. And I will turn it over to Helen.
Thank you so much, Supervisor Nora Vargas, for your leadership, your kind words, and your dedication to HOPE's mission and to looking out for all citizens and residents of San Diego County. Dear San Diego Supervisors, thank you for your thoughtful proclamation. It means so much to all of us at HOPE and for the Latinas that we serve. For you to recognize Latina History Day during Women's History Month, because it commemorates the important role Latinas play in American society. A special thank you, as I mentioned, to Nora Vargas, Supervisor Nora Vargas, for making this resolution possible and for ensuring that Latinas throughout San Diego have an opportunity to participate in hope and opening those doors. And we honor her for her accomplishment as being the first Latina elected to San Diego County Board of Supervisors, herself making history. Acknowledging the contributions Latinas make to the county and the civic life in San Diego County, in our state, in our nation, is at the core of celebrating Latina History Day. And we at Hope are working hard to ensure Latinas, who make up close to 20% of the state's population, achieve fair representation and excel in being leaders in California. As we recognize Latina History Day, let it serve as a call of action to ensure Latinas are not forgotten during this pandemic, and that our small businesses, parents, and children are part of the recovery. I know all of you as supervisors are working hard to ensure that. Thank you again for the proclamation, and we look forward to working with each of the supervisors in our quest, our mission to ensure Latinas are reaching economic and political parity. Have a great afternoon, and thank you for this recognition.
Thank you. Thank you, Chair Fletcher.
Thank you. Do you have one also for American Red Cross Month? Oh, you did both. Sorry.
Thank you. No problem.
All right. Our final proclamation today will be given by Supervisor Joel Anderson, honoring retired Grossmont Healthcare District and Padre fan Barry Jantz. Accepting this proclamation will be Mr. Barry Jantz. Joel?
Well, I'm very pleased that my very first proclamation is to my good friend Barry Jantz, who I've known since college, and I've witnessed his lifetime dedication to East County and improving the lives of the people around him. Barry, while still in college, decided that public service was important to him and ran for La Mesa City Council, winning at that early age and serving 16 years on the La Mesa City Council, then later taking a job as the district chief of staff for then Assemblyman Jay Lesueur. Afterwards, he went on to become the chief executive officer of Grossmont Healthcare District in 2004 and served 17 years there before retiring. Barry is his wife, Colleen, and his daughter, Kaylee, have been supportive of his career. He's given many hours to the community. He also served on the East County Economic Development Council, the East County Chamber of Commerce, and the San Diego Taxpayer Educational Foundation. Barry has been very committed to our community. He's helped a lot of people along the way, and I'm sure he'll continue to help people because that's his nature. And with that, I'm very pleased to recognize, along with my colleagues, Chair Fletcher and all the supervisors, that for his outstanding service, leadership, and commitment to the citizens of San Diego County, we hereby declare this day Barry Jantz Day and throughout San Diego County. Now, if I was still in state senate, I'd make it the whole state, but right now I'm a supervisor, so I'm afraid I can only do the county. But Barry, thank you so much for your service. Thank you to your family for allowing you the free time, because I know the time you took away from your family to do all this great work. And I really appreciate it on a personal level, but as a supervisor, I wish there were more Barry Jantzes out there. And with that, do you have any words to share with us?
Supervisor Anderson, you probably know I have a few words, but just thank you, Joel, and thank you to the rest of the supervisors for this honor. I never, a year ago, I never thought I'd be accepting something like this while wearing a suit, tie, and slippers. But it's the nature of the time we live in. It's been a challenging and difficult time, and I just want to applaud the supervisors and the County of San Diego for all the great work you're doing to meet this challenge. Maybe I'll always consider Barry Jantz Day going forward as the day we're moving into the red tier as a really good sign that things are going in the right direction. But I just want to thank everybody at the Grossmont Healthcare District for the years I was able to serve there. Not only my current board of directors, the 5 of them, but I think I counted 10 previous board members that I worked for over the last 16 or 17 years. and the staff at the Grossmont Healthcare District. So it's nice that I'm still going to be engaged. I'm going to be involved in East County, and when I drive by and I look at Sharp Grossmont Hospital and see some of the projects we did, that I know it was a great team effort, and I got to be involved in it a little bit. And lastly, just thank you to my family, my wife Colleen and my daughter Kaylee, for all the support over the years. And once again, thank you to you all.
Thank you. Next on the agenda is non-agendized public comment. This is an opportunity for the public to address the board on subject matters that are within our jurisdiction but are not an item on today's agenda. The only action the board may take is a referral to the Chief Administrative Officer, and a reminder, according to Rule 4A, members of the public that are non-English speaking and need interpretation assistance will get twice the allotted time for their comments to allow for translation. At this point, I will ask the clerk to call forward our public speakers for non-agendized public comment.
Thank you, Chair Fletcher. We have 10 requests to speak on matters not listed on the agenda. Any members of the public that have requested to speak during non-agenda public communication, please dial into the conference line now using the instructions provided to you. We will be calling speakers by the last 4 digits of your phone number. You'll hear notification that your call has been unmuted. You will then need to press *6 to unmute your phone. Each caller will be asked to state their name for the audio record, and you will have 2 minutes to address the board. You'll hear this sound when your time is up, so please conclude your comments at that time. I would remind the public speakers that they should mute their TV or live video stream before they begin speaking. Aaron, if you could please identify the first caller.
Thank you. Our first caller is 4592. 4592.
Good morning, Chair, Supervisors. My name is Kathleen Lippett. As an advocate of public health and sound public policy, I am hopeful the new supervisors will consider making their own independent decisions on behalf of their constituents, rather than following the lead of someone who seems to have been unduly influenced by political and economic aspirations. Fiscally responsible leaders do cost-benefit analyses to raise the capacity of their constituents to make informed decisions. Socially responsible leaders prioritize public health. Honest and transparent leaders concentrate on the priorities they know are important to the voters who elected them. And civilly responsible leaders respect the minority opinions of their colleagues rather than punishing them. The priorities of residents are to improve the quality of their lives, families, and communities, to increase their opportunities, to make healthy choices, engage in healthy activities, have access to fresh foods, good educational opportunities, and to be safe on their roadways. They want industries that will contribute to, enhance, and raise the potential for their children to succeed in life, to enable them to become socially responsible citizens and positively serve others. Supporting medical, biotech, and life science industries offers such opportunities. An industry that serves only itself, traffics and profits from addiction, increases the availability, access, production, sale, and use of dangerously high THC potency drugs intended to increase addiction and heavy use is their polar opposite. Thank you for letting me speak.
Thank you. Our next speaker is 6676. 6676. (6676). Please press *6 to unmute yourself.
Good morning. This is Katie Papanyak. I'm a counselor. On March 2nd, I spoke about my concern for the county foster youth at San Pasqual Academy and heard many speakers refer to the Board of Supervisors' drive to support marijuana businesses in the rural parts of the county. I have to wonder, has the county done a needs assessment with us to see if this is a priority? Most of us would rather have a Costco or a Home Depot closer to home or our potholes fixed rather than a pot shop on the corner. I drove on Highway 67 and many other back roads visiting foster youth in group homes, and I've seen many tragic accidents on these twisty county roads. It's hard to believe that you want people to go to a dispensary or a lounge, indulge, and then find their way home. As the smart lady from Fallbrook mentioned, there is a standard DUI test for alcohol, but none yet used for marijuana. A man reportedly on drugs just plowed through killing homeless people on a straight road near City College. I fail to see the urgent need for marijuana businesses in our rural county. Please use your resources to mend the issues you campaign for and keep residents safe. Thank you.
Thank you. Our next speaker is 7613. 7613.
Good morning. My name is Becky Rapp. I'm a concerned parent and public health educator. I'm here today to thank you for extending the deadline on the proposed marijuana ordinance. It's extremely evident that planning groups and community members would like more time to process and understand the ordinance and then be able to give educated recommendations. As you move forward, I would strongly encourage you to take a closer look at the negative effects on young people. Former Congressman Patrick Kennedy recently stated that he sees the marijuana industry viewing younger consumers as cash cows. The industry is banking on them becoming heavy lifetime users, following the trend set by companies such as Altria Philip Morris and Juul. It's also interesting that Altria Philip Morris, the tobacco giant, has recently made multi-billion-dollar investments into the marijuana industry. Juul is also lobbying in support of marijuana legislation. It's obvious that the marijuana industry wants to hook kids. A local legal marijuana dispensary in our county recently had a re-grand opening. Some of their advertising went like this: Urban Zen, Chili Mango Stone Gummies, free with every purchase. Dime bag, buy one, get one tart all weekend. Buy one, get one moon edibles all weekend. Language such as this is directly speaking to youth. I would like you to consider that flavored marijuana hooks kids too, and recognize the tobacco industry is planning to take full advantage. Thank you.
Thank you. Our next speaker is 8688. 8688.
Hello, this is Catherine Rhodes, and I wanted to talk about the homeless people who died yesterday in downtown San Diego getting hit by a car. You know, now you used to have 3 hotel rooms under the project room key, and now you only have 2 hotel rooms. You now have 117 empty rooms. You have 523 rooms occupied and 640 secure. So you have so many available rooms that you could put people into, but instead of putting people into them, you're saying that you're not allowing anybody to go into it. And also still people who went to the hospital, some people still haven't been able to get back into these hotel rooms. And so, I wish you would do something to help the homeless in San Diego. You're not doing anything. You have free money coming from the federal government, from FEMA, for 100% reimbursable hotel rooms. And instead, you are not applying for the money. I haven't seen that you actually applied for any of the money to be reimbursed before or for the future. And so this is just a missed opportunity. And please do something. Please tell your staff to open up more hotels, get all these homeless people in. There was no reason for all these people to die yesterday. You could have done something, but instead you guys didn't do anything. You always talk about leadership. We actually need somebody in leadership to say, let's open these hotels, to tell your staff, why are you closing these hotels down? Open even more of them. Right now, you still have 2 hotel rooms open. You get free money until September 30th, 2021, 6.5 more months. Please help as many people as you can. Thank you.
Thank you. Our next speaker is 2153. 2153.
Good morning, supervisors. This is Kelly McCormick. I'm speaking because I'm a parent and I'm committed to ensuring accountability for those who pollute the environment and contribute to global warming. If the county proceeds with allowing indoor marijuana farms, it will come with a high cost. A new study by researchers at Colorado State University finds that indoor pot grows have a significant carbon footprint. The study was published in Nature Sustainability. The emissions from growing just 1 ounce of marijuana is about the same as burning 7 to 16 gallons of gasoline. Colorado is the 10th largest coal producing state in the US. However, indoor marijuana farming already has a bigger carbon footprint than coal mining. In fact, the emissions of carbon dioxide are 30% higher from pot farming than from coal mining. The main culprit is the natural gas and electricity needed to maintain high-intensity grow lights around the clock and environmental controls, including heating, air conditioning, ventilation systems, and dehumidifiers. The Board of Supervisors has named the fight against climate change as a top priority. Why then would you endorse an industry known to contribute to greenhouse gas emissions? California already produces many times more marijuana than it consumes. Why then is there an effort to add even more to the glut? Outdoor pot farms have their own set of problems, including the use of pesticides, fungicides, and rodenticides, heavy water usage, and the terrible skunk smell that permeates surrounding communities around harvest time, which takes place about every 2 months. If we are serious about reaching our climate action goals, then we must take a hard look at the types of industries that are permitted to operate in San Diego County. Thank you.
Thank you. Our next speaker is 1822. 1822. Please press *6 to unmute yourself.
Good morning, Supervisors. This is Peggy Walker. I too believe that extending the deadline on the proposed marijuana ordinance is a good thing, and I thank you for that. I have attended a couple of planning group meetings where I have interests, and I'm hearing that people don't like the idea of their communities being sold out to drug vendors. They feel disenfranchised, they fear loss of local control, and they certainly don't want land use decisions left to highly paid marijuana lobbyists. A major concern is the social equity program, which really isn't equitable, but seems like a ruse to steamroll more drug businesses into our county. I've worked as a public health advocate 30 years, and I've never heard a single minority parent ask for more addictive drugs in my neighborhood. They worry about kids with nothing to do, hanging out where dealers sell them marijuana. While minority communities were hit harder by arrests in the past, it's true, they were also hit harder by the harms. More cases of cannabis use disorder, more psychosis, schizophrenia, and more victims of marijuana-related violence. So social equity doesn't help minorities, it further marginalizes vulnerable communities. And it's amazing to me how you push this when you seem to be focused on the well-being of youth in your districts. John Alvarado, who's head of the Good Neighbor Project in Logan Heights, told the San Diego City Council last week that marijuana is killing kids in his neighborhood. We need people to stand up and speak out about what's really happening with drugs, he said. We are losing our young people to overdose into marijuana. Please, supervisors, please be a source of the truth, not just how much money you can make off marijuana. Thank you.
Thank you. Our next speaker is 9887. 9887.
Hello. Hi, Supervisors. My name is Carol Green, and I wanted to speak to you today about some concerns that I have about your conflicting goals. While I support all of your goals in equity and in helping youth, I think that you are making some errors along the way. For example, as I looked at the agenda today, which I'm not speaking on agenda items, but just keep this in mind, I noticed safety on the county roads due to wildfires, positive youth development, and other youth-oriented programs, which sound amazing. Yet the board is looking at an ordinance that would undermine these goals and negatively impact mental and physical health of our young people. I've shared my excruciating story with you about how my son experienced psychosis and later died as a result of using marijuana. I can't tell the whole story again today because it's just actually too hard for you. But as you consider moving forward on allowing more commercialized marijuana businesses in the unincorporated areas of the county. Consider the message you are sending to everyone, especially our young people. You are saying to my children that this is safe, that it's normal, and that it's okay. There's a big difference between not putting people in jail and commercializing this substance. Consumption lounges, the worst idea ever. You are possibly increasing impaired driver. Well, I think you're definitely increasing the possibility of impaired drivers on some of our most difficult and dangerous roads, not to mention the other negative impacts. As you discuss great programs to help our kids and positive youth development, why not consider the impacts of marijuana on triggering and causing psychosis, anxiety, and depression? Look up the information, don't believe me. Let's send consistent messages to our kids. I'm shocked that the same people who are in favor of a flavor ban are now promoting this. Thank you.
Thank you.
Thank you. Our next speaker is 3800. 3800.
Thank you. My name is Barbara Gordon. I'm here today to express my concerns with the Board of Supervisors' decision to allow marijuana businesses in the unincorporated area. The quality of life for those that could be impacted by storefronts, cultivation, consumption lounges cannot be underestimated or dismissed by the supervisors. If you allow marijuana businesses, one of the most frequent complaints is odor coming from marijuana cultivation or processing. Addressing odor needs to be a priority for the board as it negatively affects neighborhoods. Strict regulations regarding odor needs to be expressly written into any ordinance. It is your duty and responsibility as the Board of Supervisors to protect our community. Public health and safety needs to be your priority, not promoting the marijuana industry's predatory practices. Thank you.
Thank you. Our next speaker is 6598. 6598.
Good morning, Judy Strang. I attend the unincorporated area planning group for District 3, the San Diego planning group, and have wanted to thank our new supervisor, Tara Lawson-Remer, for the attendance of your aide, Evelyn Andrade. She's been a breath of fresh air. Her understanding of the needs of the unincorporated area and her willingness to be an instrument in transferring information from your office to them and back is greatly appreciated. I wanted you to know that this particular county planning group and others that I have attended in the past are not the least bit interested in having marijuana businesses in the unincorporated area. And recently, the Cancer Action Network released a statement particularly concerning one aspect of the ordinance, which are consumption lounges. And they urge, according to this release, that this type of language be removed from any proposed marijuana ordinance. They point out that secondhand smoke exposure from marijuana is dangerous, according to the Surgeon General, and contains many of the same carcinogens that are in tobacco smoke. And research shows that when marijuana is smoked, vaped, or aerolized, that there's a significant risk to the user and to those around them. Also, they feel that the California smoke-free work laws would be considerably compromised, that employees should never have to be exposed to secondhand smoke or vape of any kind, including marijuana. Additionally, allowing food and beverage service in a lounge creates a greater potential for exposure, while allowing lounges to locate in buildings with shared walls, floors, or ceilings allows neighboring tenants to be involuntarily exposed. As they said in their statement, everyone deserves to breathe clean air where they work, live, and play. Thank you.
Thank you. Our next speaker is 9415. 9415.
Good morning, Supervisor, Chairman Fletcher, and Supervisors Vargas, Anderson, Lawson-Remer, and Desmond. I'm Ronald Stark, a resident of District 4. I work as program manager for Mental Health Systems North Inland Substance Use Prevention, contracted by the County of San Diego HHSA to provide substance use prevention services in the North Inland region, serving Escondido, Poway, San Marcos, San Diego communities, Rancho Penasquitos, Rancho Bernardo, and Forest Ranch, and other unincorporated towns, Fallbrook, Valley Center, Ramona, Julian, Warner Springs, Duluth, Bonsall, Santa Isabel, many rural communities and several tribal nation areas in the North Inland region. This covers about 2/3 of District 5, 1/3 of District 2, and 1/3 of District 3. I'm president of San Diego Veterans Coalition, leading collaboration, coordination, and integration of organizations countywide that serve some 250,000 veterans and their families and active duty military and their families. I'm on the board of directors for Us for Warriors Foundation, serving largely in District 1. I'm chairman of the board, chairman of the One VA Community Advocacy Board, a national model for VA's community veteran engagement. I attend Community Bible Church in District 3. I do not say all this. I'm a United States Navy veteran, retired, and served as a submarine sonar technician, Vietnam era, in Cold War operations, and I served in Desert Shield and Desert Storm. I told you all this to give you an idea of my fields of observation in San Diego County, but I'm speaking on behalf of myself and not any other organization. I've learned in my years as a submarine sonar technician, serving in the North Atlantic and Mediterranean Sea, to listen for things you do not hear. Be especially keen for the absence of noise. Those are areas you should go hunting, because that's where real dangers exist. Here's some things I have not heard before and since. I do not hear parents saying they need more places to buy marijuana, THC products close as possible to our homes, schools, parks, and places our kids shop and play.
Thank you, sir. Your time
is up. Thank you. And that concludes the request for non-agenda public communications this morning. Chair Fletcher.
Thank you, and thank you to everyone who called in today. Next on our agenda is approval of the board meeting minutes, statement of proceedings for the meeting for the board conference on probation, February 23rd, 2021, and the regular Board of Supervisors meeting of March 2nd, 2021. I will make a motion for approval. Is there a second?
So moved.
All right, we have a motion by myself and a second by Vice Chair Vargas. I'll ask the clerk to call the roll.
Thank you. Supervisor Anderson? Supervisor Anderson?
Disconnected.
I'm hearing Supervisor Anderson. Supervisor Lawson-Remer?
Aye.
Supervisor Desmond?
Aye.
Vice Chair Vargas?
Vargas, aye.
Chair Fletcher?
Fletcher, aye.
Anderson, aye.
Great. Thank you, Supervisor Anderson. That motion passes unanimously with all supervisors being present and voting aye.
We'll now proceed with the formation of our consent calendar. I'll ask the clerk to begin if there are any items the public wishes pulled.
Thank you, Chair Fletcher. Item 1 has been pulled by the public. Item 3 has been pulled by the public. Item 8 has been pulled by the public. Item 9 has been withdrawn at the request of the Chief Administrative Officer. Item 10 has been pulled by the public. Item 11 has been pulled by the public. Item 12 has been pulled by the public. Item 15 has been pulled by the public. Item 21 has been pulled by the public. Item 22 has been withdrawn at the request of Supervisor Anderson and Vice Chair Vargas. Item 23 has been pulled by the public. Item 25 is a presentation matter. Item 27 has been pulled by the public, and item 28 has been pulled by the public. Item 31 are closed session matters that will be considered at the conclusion of the board's public session. All the remaining items on the Board of Supervisors agenda may be placed in the consent calendar for your board's consideration.
Thank you. At this point, I will go to my colleague, Supervisor Anderson. Are there any items you wish to pull or comments you wish to make?
At this time, thank you.
Thank you. Supervisor Lawson-Remer?
I'm sorry, not at this time, thank you.
Supervisor Desmond?
I have no items to pull, but I'll make a motion to approve the balance of the agenda, the consent agenda.
Thank you, Supervisor Desmond. Vice Chair Vargas?
For clarification, item number 11 was pulled.
Yes.
It's a presentation. Okay, thank you. I'll make a second the motion.
Okay, perfect. So we have a motion and a second to approve the consent calendar. Before we do that, I want to just make brief comments on items 2 and 4, along with item 13. Items 2 and 4 are part of our efforts around probation. We, of course, did a board conference where we heard a lot of best practices, a lot of best ideas, and I think in that spirit, both items 2, 3, and 4 today are moving forward to try and fulfill this commitment to reimagining our probation system. One of these items, item 2, is adopting the name of Youth Transition Campus for the Future Residence Center for our youth probation. The name conveys something different than juvenile hall or things that's been called in the past, a youth transition campus. And I think it really reflects the spirit of what we're trying to get out of this property, which is a place for youth to learn and grow, not a punitive place of punishment. And I think this is the direction that we are headed as a county. Item 4 is more on the adult side of probation, but I think this is a very important program as well, our residential treatment programs. And these new changes that we're doing in these programs, again, are designed to try and provide rehabilitation and restoration. This solicitation for proposals to provide residential treatment programs for probation represents what I believe is a key to supporting transition from incarceration and helping adults achieve success. And I think both of these are positive steps forward that we are taking. On item 13, I am pleased to see us accept funding to support our tobacco control efforts. We took a lot of work over the preceding 2 years to establish our tobacco retail licensing, our ban on flavored tobacco products, and are really closer, I think, to continuing to move forward, and going after this grant is another step in the right direction. And so pleased to support all of those. With that, we have a motion by Supervisor Desmond, a second by Vice Chair Vargas. I'll ask the clerk, before we call the roll, to confirm one last time the items that we will be hearing today, and then call the vote on the consent calendar.
Thank you, Chair Fletcher. The following items have been pulled for discussion by the board today. It's items 1, 3, 10, 11, 12, 15, 21, 23, 25, 27, and 28, and item 31 are closed session matters. With that, Supervisor Anderson?
Aye.
Supervisor Lawson-Remer? Supervisor Desmond?
Aye.
Vice Chair Vargas?
Vargas, aye.
Chair Fletcher?
Fletcher, aye.
That motion passes unanimously with all supervisors being present and voting aye.
We're going to go to our agenda items. What we're going to do is take our COVID update, item 11 first. We have a number of our COVID staff who have a lot of work to do today, and we want to allow them to carry on with their work responding to COVID. So we'll get our presentation on agenda item 11. After that, we will go to agenda item 12, the update regarding San Pasqual Academy. We have a number of callers there. And then after we do 11 and 12, we will return to agenda order for the duration of our meeting today. So let's start with number 11, and I will turn it over to staff for a presentation.
Before the staff presentation begins, any members of the public that have requested to speak on item 11, please dial into the conference line now using the instructions provided to you. You will be muted until it is your turn to speak. Thank you.
Chair Fletcher and members of the board, good morning. For today's presentation, Dr. Wilma Wooten will provide a public health update, as well as an additional information on the county status of the state's tiered system. Nick Masciona, our agency director and head of T3, will update on the vaccination efforts underway throughout the county, as well as an update on countywide outreach, education, and communication efforts. Then Andy Pease, our Incident Command Finance Chief, will provide an update on funding sources. And finally, David Estrella, Director of Housing and Community Development Services, will provide an update on the Emergency Rental Assistance Program. Without further ado, I'll welcome Dr. Wooten.
Thank you, Don. Good morning, Chair Fletcher and members of the board. The current epi-curve on this slide shows COVID-19 cases by onset of illness and provides a historical review of daily cases to date. The regional stay-at-home order was lifted by the state on January 25th. As the number of cases by onset of illness has continued to decline, and as vaccinations in San Diego County reach over 1 million, cases continue to further decline. In the last 14 days of the epi curve depicted by the bar to the far right of this slide, we know that more cases will be reported, but as more people become vaccinated, these cases will decline. In a close-up view from January 1st through March 14th, 2021, daily case counts have continued to decrease. In the 17-day period from February 27th, or rather 26th to March 14th, cases have been at or below 500. And in the past 2 days, daily case counts have been below 200. We continue to see a downward trend in daily cases, leading to a positive change in the county tier status. Since the last presentation to your board on March 2nd of this year, an additional 5,024 laboratory confirmed cases have been reported, for a total of 265,649 positive COVID-19 cases. These numbers are as of 11:59 p.m. Sunday, March 14th. This table provides a summary of cumulative cases with a breakdown by age, gender, hospitalizations, ICU admissions, and deaths. The age range of all cases is from 0 to 108 years of age, with a median age of 36 years. The 20 to 49-year-old age groups continue to comprise 54% of all cases. Gender breakdown remains unchanged. Hospitalizations make up 5% of all cases, and thankfully hospitalizations are declining, as you will see shortly. 1,627 of those hospitalized have been admitted to the ICU, and these numbers are also decreasing and make up approximately 0.6% of the total number of cases and 12.2% of the total number of those hospitalized. The total number of cases also includes 3,452 deaths, or 1.3% of all cases. The age range for those who have died is 10 to 106 years, and the median age is 77 years. All COVID-19 data and more information can be found on the county's website, www.coronavirus-sd.com. Now, looking at the trends for hospitalizations and ICU admissions, we will share percentage declines during the past 30 and 14 days. This figure shows the status of San Diego County's non-federal adult and pediatric hospital beds. In the past 30 days, hospital census data from February 13th through March 14th show a decreasing trend of 66%. In the past 14 days, from March 1st to March 14th, the data shows a decreasing trend of 39%. For ICU admissions in the past 30 days, from February 13th through the 14th, a declining trend of 68% is seen. While the last 14 days for ICU admissions from March 1st to March 14th, ICU census decreased by 40%. The dashboard, the triggers dashboard, monitors data in 3 categories, and we have seen this dashboard have red almost for all of the triggers noted. Today, only one of the 13 triggers on this dashboard has exceeded its threshold, which is community outbreaks. It is very encouraging, however, to see that community outbreaks have continued to decrease, nearing almost 100 approximately 3 months ago. But these numbers have decreased during the past few months of this year, and we are much closer to the normal threshold of no more than 7 outbreaks in the past 7 days. Today, we are reporting 15 outbreaks in the last 7 days. Now, as shared in prior presentations, the state's monitoring system continues, or rather includes, 3 core metrics: case rates, testing positivity, and the health equity metric. The health equity metric evaluates the testing positivity of areas that experience the least healthy conditions in our county. For this week, the county's testing rate was calculated by staff to be 321, which is approximately at the same percentage as the state's median testing rate. At this percentage, the county's adjusted case rate is essentially unchanged from the unadjusted case rate of 6.8. And this is specifically for a threshold of 4 to 7 per 100,000. This places the county in the red tier. However, with the new statewide vaccine equity metric, if the state achieved 2 million doses of vaccines administered in the vaccine equity quartiles, which occurred last Friday, the case rate threshold expands from 4 to 7 to 4 to 10 per 100,000 population, making it easier for counties to move to the next lowest tier. With this new methodology, San Diego also has reached the red tier for the past 2 weeks. And on tomorrow, Wednesday, the county can officially move to the red tier. The state is expected to publicly post its state's metric calculations by noon today. Now, in this next slide, with the regional stay-at-home order lifted, the state is back operating under the blueprint for a safer economy framework. And this information is as of Sunday, March 14th. At that time, the state had 20 counties in the purple tier, 33 in the red tier, 3 in the orange tier, and 1 county in the yellow tier. As we wait for the state to post this week's calculated metrics, we are showing metrics based on calculations by our county staff. So again, the unadjusted case rate for February 28th through the March 6th, after a 7-day lag, is 6.8, with the adjusted case rate also being 6.8. Again, placing us in the red tier. The testing positivity is 2.8%, which is the orange tier, and staff has also calculated the health equity positivity metric to be 4.2%, also consistent with the orange tier. Now, this slide shows the trend for unadjusted and adjusted case rates over time. And now that the expanded threshold for case rate to be in the purple tier has changed to 10 or higher per 100,000 populations, you see that San Diego is in the red tier. Given the current adjusted case rate is approximately 6.8, again, San Diego has reached the red tier. Now, while there is indeed good news regarding the declining COVID-19 daily case counts and the local anticipated positive change in our tier status, there is also the looming news of the B117 or the UK variant that is a potential threat. As of yesterday, March 15th, in San Diego County, 279 confirmed cases have been reported, which is 82 more cases than reported to you 2 weeks ago. Of the total cases, there have been 4 hospitalizations, 1 additional hospitalization since our last report to your board, and 1 death, which is unchanged. The median age is 36 years, and the age range is 0 to 93 years of age. 52% of the cases are female, 48% are male. And to date, no cases of the South African variant have been identified locally. In closing, as cases are declining and more people are vaccinated, the future is very bright. As we wait for the arrival of more J&J vaccines next week, and as well more Pfizer and Moderna vaccines, all San Diegans are urged to continue following all prescribed health precautions. The CDC released guidance for fully vaccinated individuals recently. They are advising individuals that are fully vaccinated that they can visit with other fully vaccinated individuals indoors without wearing masks or physical distancing. Fully vaccinated individuals can also visit indoors with unvaccinated individuals from a single household who are at low risk for severe COVID-19 disease without wearing masks or physical distancing. And these individuals should refrain from quarantine and testing following a known exposure if asymptomatic. In alignment with the CDC and the state, the public is encouraged to still wash their hands, watch their distance, and wear their face mask. And also, individuals, whether vaccinated or not, are advised to strongly avoid medium and large in-person gatherings. If individuals are sick, isolate at home and get tested, and when it is your turn to receive the COVID-19 vaccine, get vaccinated. Thank you to everyone for your continued vigilance to help San Diegans be COVID safe. Now, please welcome Agency Director Nick Mashian.
Thank you, Dr. Wooten. Now 3 months into our COVID-19 vaccination efforts, we remain steadfast in our race to vaccinate 70% of our county residents age 16 and older by July 1st. Now, this equates to approximately 1.8 million San Diegans, and doing so will only be possible with the collective effort of San Diegans rolling up their sleeves and getting vaccinated, and our vaccination partners doing their part in standing up an entire regional vaccination ecosystem. And as you can see in this slide, this includes not only the county-hosted efforts such as our pods and superstation and mobile vaccination efforts, but also, importantly, the partnerships with our hospitals, our clinics and cities, and many nonprofit organizations. The combined estimated daily capacity of these efforts continue to grow. And currently, we can vaccinate 34,000 San Diegans per day, which translates to over 1 million vaccinations in one single month. When combined with local pharmacies' vaccination sites, San Diegans can now access nearly 160 vaccination sites countywide. And this total doesn't even include the vaccination efforts operated by some of our community clinics, the military, the Veterans Administration, tribal health programs, and the urban Indian organizations across the entire region. Now, as of yesterday, March 15th, individuals ages 16 to 64 with qualifying underlying health conditions have joined the list of eligible groups for vaccinations. This also includes an array of other groups that the state provided further guidance on, such as foster parents, public transit workers, janitorial workers, people experiencing homelessness, and others that are detailed on our county website. This adds to an already eligible population that includes, as we know, residents of our skilled and assisted living facilities, all the healthcare personnel, including those working in acute and long-term care facilities, public health, behavioral health, outpatient, inpatient clinics, and many other groups, such as the ages of 65 and older, our emergency services sector, the education, child care, food, and agriculture. I lose my breath. We have so many groups. And with all these individuals now eligible and the robust capacity of our vaccination infrastructure and capability, the supply of vaccine remains the major impediment to vaccinating more San Diegans. It's our hope that working collaboratively with the state of California and their third-party administrator, Blue Shield, that they can further support our work in getting us a whole lot more vaccines as soon as possible, so we can continue on our work and uninterrupted in administering them countywide with emphasis in our health equity areas. Now, as you know, our county-sponsored and hosted locations are organized with not only an emphasis, but a priority for health equity. Vaccination events and the county hosts or sponsors with our partners remain overrepresented in communities hit hardest by COVID-19, and in a moment I'll share you some of the data to demonstrate that. This now familiar map reflects census tracts that have the least health opportunities and are in the health equity quartile. Our vaccination sites are inside or directly adjacent to these areas, and we're now supporting 6 superstations and 21 county and partner vaccination sites with numerous mobile vaccination efforts, including Operation Collaboration, led by CAL FIRE and other city fire agencies. And as we've discussed, there are many other avenues to vaccinations that are available in our region, including pharmacies, which are now in full swing with the Federal Retail Pharmacy Partnership Program to provide direct allocations to retail pharmacies. What does that mean? Our county now is up to 130 pharmacies offering vaccinations. And this map represents physical locations, but the county's vaccination efforts go beyond brick and mortar sites. We know in our health equity work that place matters, but it's more than just location. It's how we assist our fellow San Diegans by helping them navigate the vaccination system in their native language, whether it's through getting them appointments or explaining the importance of T3 and COVID-19 vaccinations and the associated health benefits to themselves and their families. So, connecting with our community has been a top priority throughout this pandemic. And our COVID-19 education and outreach branch, led by our own Carrie Riccatelli, and our community partners has been instrumental in developing timely, culturally appropriate resources across 3 focus areas. We call this the sector engagement, community outreach, and media communications. At the beginning of the pandemic, partner sectors from our Live Well San Diego framework were quickly expanded to 9 total community sectors and 12 subsectors. The sector engagement efforts have strategically guided hundreds and hundreds of stakeholders and community partners and residents in understanding the policy and the health impacts of COVID-19 through their sector-specific lenses. Focused community outreach efforts have also successfully collaborated with community partner organizations to reach those most affected by COVID-19 through our community health worker or promotora model. Trusted messengers work specifically in 4 focused communities: Latino, African American, Asian Pacific Islander, and our refugee communities. These groups have provided valuable input into our region-wide vaccine messaging that we've helped disseminate through a broad range of communication channels such as radio, television, and social media. Now I'll highlight the widespread impact and value of these 3 focus areas, starting with the sector engagement. The sector model has been proven to be successful in providing very timely information related to COVID-19 disease and vaccine, reopening guidance, and resources for their identified needs. Since March of 2020, a year ago, the sectors have conducted 525 telebriefings with nearly 60,000 views, completed 240 COVID presentations that were viewed over by nearly 8,000 attendees, and sent out over 1,000 e-blasts to nearly 19,000 stakeholders each week. Through regular live telebriefings and sector assessments, staff learned about the needs of their most vulnerable communities and worked innovatively with partners to address those needs. Let me share a few examples. The homeless sector partnered with the Lucky Duck Foundation and other community partners and have created and distributed more than 25,000 COVID-19 prevention hygiene kits across the region to unhoused individuals. The healthcare sector has engaged over 220 healthcare practices in vulnerable communities based on health equity zip codes to expand resources for their patients in our highest need populations. The government sector has kept leaders from all 18 cities informed, as well as the local tribal nations. The sector's binational subsector is the only formal cross-border structure formed in response to the COVID-19 pandemic along the entire U.S.-Mexico border region. And I mind you, we've also done both testing and now vaccinations with the Mexican consulate here in the U.S. in San Diego. These are just a few of the many examples of the impact the sector has had in our community and continue to do so today. Now, with our community outreach efforts, we've contracted with 12 community partners who are utilizing the community health worker promotora model to provide education and outreach services and contact tracing. With over 26 languages spoken, 200 community health worker and or promotoras are the trusted members of the communities most impacted by COVID-19. More than 220,000 people have been reached through focused outreach, such as phone calls, in-person outreach, and electronic newsletters and text messaging, and more than 8 million referrals and information on testing and vaccinations have been made. Partners have created culturally and linguistically appropriate materials for the communities that they serve, as well as launched media campaigns that have reached nearly 10 million views. To date, our contract tracing partners have conducted approaching 130,000 investigations. And under the leadership of Chair Fletcher and Vice Chair Vargas, Project SAVE, which stands for Scheduling Assistance for Vaccination Equity, was launched last month. It was designed not only to address vaccine hesitancy, but to also reach our hardest to reach communities and help them sign up directly for vaccination appointments. For this pilot program, the community health workers and promotores are engaging in outreach at grocery stores, faith centers, food distributions, housing complexes, to name a few. They're also referring residents to no appointment sites at our county pods and are working with partner organizations who serve grocery workers, family child care providers, and janitors to ensure they have access to vaccinations. Even though supply has been limited, this has resulted in almost 200 individuals who would not know how to sign up, who we helped sign up for appointments, and over 1,200 no appointment vaccinations provided to these essential workers. And this next one is really important to me because this past Saturday, we did a no appointment pilot to vaccinate 170 janitors. And my dad was a county employee janitor back east for most of his life. Helping people like my dad, that's what we're doing with the county team. Our community health worker model has proven so successful, we have completed now competitive procurement to bring on additional community partners to build on and expand this work to other communities throughout the entire county region, particularly as vaccine supplies increase in the coming weeks and months. Now, from the start of the pandemic, timely, transparent communication was an essential part of our response. And we also focused messaging to reach our most vulnerable communities, particularly those at higher risk of being disproportionately impacted by COVID-19. As the messages have evolved throughout the pandemic, from stay-at-home orders to testing, tracing, and treating, and now vaccination guidance, community partners have been instrumental in helping to develop our messages. We've used the expertise of our public health officer, Dr. Wilma Wooten, and our agency's epidemiology leaders like Dr. Eric McDonald and many other health experts at regular media briefings, along with our community partners and professional media companies to ensure that our messages were effective and culturally appropriate and maintained that throughout this entire public health emergency. In addition, we conducted a countywide vaccine hesitancy survey to better understand the demographics of those least likely to take the vaccine and design effective messages tailored to be delivered by our trusted messengers, namely doctors and other healthcare professionals. We have utilized a variety of channels to reach our populations, and initially we built on the services from our county communications office and added specialized advertising in English and Spanish and community outlets such as Voice and Viewpoint, Filipino Press, El Latino, and many other community neighbor papers. In March of 2020, we started a marketing campaign focused on broadcast, digital, and print advertising in English and Spanish. And we developed campaigns focused on the fourth quartile communities to address issues such as wearing masks and vaccine hesitancy. With the recent addition of new, large vaccine-eligible groups of residents and others expected to be close behind, a recent launch of radio and digital advertising has been joined by television, print, billboards, transit advertising, and in-store information, and with the sectors and the community health worker promoter organizations helping to amplify, be force multipliers with these messages in our community. And now I'd like to share an example of this one type of a commercial. Please, let's play it.
Cuando sea su turno, vacúnese contra el COVID-19 para protegerse a usted y a su familia. Conozca más detalles en coronavirus-sd.com/vacuna. Regresemos a pasar tiempo con nuestros seres queridos.
When it's your turn, get a free vaccine to protect you and your family from COVID-19. Let's get back to the things we love.
Learn the facts at coronavirus-sd.com/vaccine.
San Diego Health Center, Multicultural Foundation, just two of the many community partners who have helped us in development of this. You know, in this slide, it's no surprise that with all these actions by our community and our county team combined that our county region is leading the entire state in per capita vaccination rates. And as you can see, in Southern California, we far outpace all. And we've done that even with an unsteady vaccine supply. As you can see in this next slide, our region has administered 1,257,281, because every single vaccination counts. And this includes an additional 3,424 that have been administered but are pending documentation. This represents over 26% of our entire eligible population that have received their first dose and 16% that have been fully vaccinated. And we know these numbers are actually higher since they do not include what's been vaccinated by the military, the veterans, and the tribal entities. As we continue to race in protecting our entire county region from COVID-19, we're particularly proud of the work we've done to protect our most vulnerable. Many of these individuals reside in approximately 1,300 long-term care facilities and skilled nursing facilities operated countywide. Most of these facilities were primarily provided vaccinations through our pharmacy partnership program through the federal government. However, for the facilities not part of the program, mobile outreach teams were deployed through Operation Collaboration and partnerships with other fire agencies. And we are very proud that in San Diego, we have reached 100% of their skilled nursing facilities. And 94% of long-term care facilities have received at least their first dose. Over 73% of the county's population, 65 years and older, received at least one dose. They're paving the way for the rest of us. But most recently, we have received our latest data. And as you can see, nearly now over 94% of the population 65 years and older in South Region received at least their first dose. But it doesn't stop there. Our recent data also shows that the highest vaccination rate now in our entire county is the South Region, which has had and been impacted the greatest by COVID-19. Now, we can officially say that over a quarter of San Diegans who are eligible have received their first vaccine dose, and over 60% are fully vaccinated. And we're excited about this major milestone, but we have still much more work to do. We're confident with the ample vaccine supply that we will reach our goal of 70% vaccinated well before July 1st. And that concludes my update. And now next is Andy Pease, who will provide the COVID-19 finance update. Andy?
All right. Thank you, Nick. Good morning, Chair Fletcher and supervisors. The county's weekly spend rate for our COVID response continues to be estimated at approximately $11.9 million a week. Though there are some fluctuations amongst the categories, the overall spend rate remains the same as the last update. Now, assuming this trend continues, we could have costs from January through March totaling close to $150 million for all of these efforts. Right now, the county is covering the costs with local funds, but we are looking to FEMA, third-party insurance, and federal and state stimulus funds to help cover costs. And the largest funding source we'll be looking at leveraging is the recently passed American Rescue Plan Act of 2021. The $1.9 trillion American Rescue Plan was signed into law last week on March 11th. Of this $1.9 trillion, $350 billion is for fiscal aid to state and local governments. To put this in perspective, the $350 billion is 2 1/3 times larger than the CARES Act coronavirus relief funds of last year, which was $150 billion. So of the $350 billion, $195 billion will be for all 50 states and Washington, D.C. The state of California could receive a direct allocation close to $26 billion. Last time when the state received a direct allocation of CARES Act CRF funds, they ultimately transferred some of their CARES Act to the cities and counties, including San Diego. And we'll be watching to see if they might take a similar action down the road. $24.5 billion of the $350 billion is allocated to the tribal governments and territories, and $130 billion will be directly allocated to every city and county in the nation, unlike the CARES Act, which provided a direct allocation only to those local governments with a population over $500,000. Of the $65.1 billion allocated to counties, let's take a look at what is anticipated coming to our region. It is estimated that for the San Diego region, we could receive over $1.25 billion. Now, let me state that this is an estimate. We have yet to receive an official allocation, and that number could change, and we have yet to receive detailed guidelines on the specific use of these funds. However, based on what we do know, we estimate that of that $1.26 billion, about $611 million would go directly to the 18 cities within San Diego, and $647 million would be direct to the county of San Diego. To put these numbers in perspective, this is almost twice as much as what was allocated to our total region of CARES Act funds, whether direct from the U.S. Treasury or passed through by the state. Specific to the county of San Diego, for CARES Act, we received just under $390 million from the U.S. Treasury, as well as what was passed to us from the state, compared to the $647 million that we're anticipating under the American Rescue Plan. Now, there are two significant differences between the CARES Act funding and the American Rescue Plan that bears mentioning. First is the timing in the receipt of the dollars, and secondly, the period for which these funds can be used. For the CARES Act funds, within about a month of the bill being signed, the county received its entire CARES Act allocation, all of the CARES Act allocation from the U.S. Treasury. However, under the American Rescue Plan Act, we will receive half of our allocation within 60 days of enactment of the bill. So that would be approximately $324 million, no later than May 11th. And then we will have to wait a year to receive the other $324 million. Under CARES Act, we had a short window to spend the funds. The bill required the funds to be spent by December of 2020. So during that whole time period, we we had 8 to 9 months from the receipt of the dollars to spend it. Now, they have since extended it, but all during that time period, we had 8 to 9 months, and we planned accordingly. Under the American Rescue Plan, we will have until December 31st, 2024 to utilize these dollars, which gives us a little over 3.5 years. Eligible use of these funds include to respond to the COVID-19 public health emergency, to address negative economic impacts in the region, to mitigate reductions in county revenue due to COVID-19, investments in water, sewer, or broadband infrastructure, and for premium pay to essential workers of the local government performing essential work. These are very broad descriptions in how these funds can be used, and the guidelines and the details have yet to be published, and that information is critical in understanding the parameters in the use of these dollars. If the timing in the issuance of the guidelines is similar to CARES Act, then we can expect to receive that information within the next few weeks. So in closing, at the last board hearing, you directed the CAO to return with a framework after the federal stimulus bill was passed. And as part of the deliberations, there was discussion to include community workshops. This week, we are holding 5 community workshops, one for each board district, to receive input from the community in the use of these dollars. We already held 2 of those yesterday. With the completion of these workshops and in anticipation of federal guidelines and the use of these dollars, we anticipate we will be returning to the board in April with a recommended framework, including recommendations for the establishment of the needed appropriations for the current year and an estimate on the appropriations needed for the upcoming budget year, which we would handle through our normal budget process. And with that, I'll turn it over to David Estrella to provide us an update on rental assistance.
Good morning. The Coronavirus Response and Relief Act of 2021 included $25 billion nationally for emergency rent and utility assistance for households economically impacted by COVID-19. The county was awarded $48.8 million directly from the U.S. Treasury. Through SB 91, the state provided options for local jurisdictions to access additional funds. The county elected the option to receive $58.2 million from the state to administer locally. In total, between the state and federal funding sources, the county has $107 million to provide rent and utility assistance to help eligible renter households. The county's program serves the entire region, except for the cities of San Diego and Chula Vista, as those cities receive separate allocations to operate their own COVID-19 emergency rental assistance programs. In order to accept the state funds, a resolution by the Board of Supervisors authorizing participation in the program is needed. The state recommends that resolutions provide authority to receive 3 times the current allocation amount to account for possible future allocations. As a note, the $1.9 trillion approved in the American Rescue Plan includes additional funding for rent and utility assistance. And it is highly likely that we will receive additional funds passed through the state for this program. The resolution also authorizes staff to execute a standard agreement. Funds will be available for disbursement once the standard agreement is executed. The county's application portal opened on March 2nd, 2021, and will remain open through March 31st, 2021, and may be extended accordingly. As of March 12th, 2021, almost 7,000 applications have been submitted. This slide shows the percentage of applications that meet the local, state, or federal priorities. The county will continue outreach efforts through the COVID Response Outreach and Education Network, through local cities, utility companies, and districts, and other stakeholder groups. The cities of San Diego and Chula Vista have also opened their application portals as of this week. Tenants and landlords throughout the county can visit erapsandiego.org to determine their jurisdiction and to apply. I will now turn it over to Don Stoyer. Thank you.
Thank you, David. In addition to receiving this update, we recommend your board take the following additional actions with respect to this item. First, ratify all actions taken in response to the local health emergency and local emergency, which shall include all agreements listed in Attachment A. This includes contracts with Alvarado and Palomar Health to provide the foundation for these healthcare agencies to operate vaccination sites as needed, similar to other healthcare agencies in prior board letters. Similarly, the mutual aid agreement with the City of Coronado, also in Attachment A, allows Coronado to provide staff able to administer the vaccine at locations identified by T3 as needing these resources, including superstations, smaller county pods, and other vaccination events as needed. Next, adopt a resolution entitled A Resolution of the County Board of Supervisors authorizing participation in the State Rental Assistance Program. And finally, take any other actions necessary to address the COVID-19 pandemic emergency response. And subject to your questions, this concludes our presentation.
Thank you. Thank you to staff for the presentation and certainly the progress we are continuing to make. Why don't we hear from our public speakers and then we'll come back to the board. Us clerk, call forward the speakers.
Thank you, Chair Fletcher. I will note for the record that we received 24 e-comments on this item. We have 13 requests to speak on this item. Any members of the public that have requested to speak on item 11, please dial into the conference line now using the instructions provided to you. We will be calling speakers by the last 4 digits of their phone number. You'll hear a notification that your call has been unmuted. You will then need to press *6 to unmute your phone. Each caller will be asked to state their name for the audio record, and callers will have 2 minutes to address the board. You'll hear the sound when your time is up, so please conclude your comments at that time. I would remind the public speakers that they should mute their TV or live video stream before they begin speaking. Aaron, if you could please identify the first caller.
Thank you. Our first caller is 5033. 5033.
Hello. Thank you for the opportunity. Hello.
Good morning.
Can I speak?
Yep. Thank you.
Okay. Okay. My name is Gretchen Gohl. Thank you for the opportunity to speak. Regarding the big push for vaccines, they are not a one-size-fits-all solution for every person. Vaccines are a personal decision where each individual needs to weigh the risks versus benefits individually for themselves. I personally was adversely affected by a round of vaccines in my 20s. I became severely ill immediately after taking the vaccines. I lost 17 pounds in 2 weeks and had continuing health issues that led to an autoimmune disease diagnosis. You cannot ignore the fact that vaccines do cause harm, and the majority of that evidence does not make it into the VAERS system. Furthermore, if you check the data in the CDC VAERS system, in just 4 months, over 1,000 people have died from the COVID vaccine across the United States, and there have been thousands of hospitalizations. The death count in 4 months is higher than that which has been recorded for the flu vaccine in 1 decade. Why is this data being ignored? Do the lives of those who have been negatively affected by the vaccine not matter? Please help me understand your bias to be pro-vaccination rather than pro-choice. Your policies are creating a future generation of people who will no longer understand that their body has the power to heal by their immune system, and that they will just be looking for the government to fix all of their health problems. This is disturbing, disgraceful, and dehumanizing. Furthermore, San Diego County has been under stay-at-home orders for over a year now. Please tell me how we are in a state of emergency and why there is no stated expiration date. According to the California Emergency Services Act, the state of emergency can only be called if the threat overwhelms the current resources of the state. At what point have San Diego hospitals ever been overwhelmed since March 2020? Please share the data because I have yet to see it. Hospital census goes up during the month every year. This is not a new trend since COVID.
Thank you. Your time is up. Thank you. Our next speaker is 1104. 1104. Please press *6 to unmute yourself.
Good morning, everybody. Thank you. I'm sorry for that. Somebody just called me at the same moment. My name is Jerry Hall. Good morning, Chairman Fletcher, supervisors, staff, and community. Although I serve the county and community in various capacities, I speak here for myself. I'm calling to share what I have found is a problematic element of the county's COVID vaccination scheduling program. Since I fall in the high-risk category of Phase 1C, I began diligently looking to schedule an appointment on Friday, but it was not evident what the status was. I tried the Monday 15th, I tried yesterday and as well as today, and still have been unable to find any available time slot. So I started looking at other sites throughout the county, focusing on a 10-mile radius of downtown. Of the 13 locations listed by the county, 6 of those were the sites serving the neighborhoods east of I-5 and south of the 8. As I checked each of these 6 locations, I learned finding an open slot was considerably more difficult to navigate. For those areas, it takes from 16 to 30 mouse clicks to find an available slot at a single location. When one wants to check another site, they need to start over and go through the same process all over again. For me and others not in those areas, a few mouse clicks and a browser refresh allows me to find open slots much more easily, nearly instantaneously. Although I'd like to not get sick or worse, I cannot in good conscience continue attempting to schedule an appointment when I know we are making it prohibitively difficult for other San Diegans, especially those living in communities long marginalized and underserved by the county and city to do so. Until we remedy this and make it easier or just as easy as it would be for other areas of the county to schedule, I won't be getting vaccinated. When the one area of our county that houses predominantly Black and other people of color residents is being treated by our county any differently than the remaining sections of the county, we can identify that as racist health policy and practice. If it takes one of us to get sick or worse to get you to act on eliminating this practice, then here I am. Given that we've declared racism a public health crisis, I offer this as a prime example of the types of systems and practices we should be looking to eliminate. Finally, I appreciate your work and look forward to our county's post-COVID future. Thank you.
Thank you. Our next speaker is 4253. 4253. Please press *6 to unmute yourself. And if we don't hear,
Hi, my name is Diane Ake. As supervisors, you are our public servants, and I appreciate your service. However, we pay your salaries and you work for us. Since you're restricting our freedoms, not letting children go to school, not allowing people to work, causing skyrocketing drug overdose, child abuse, child trafficking, as mentioned by the DA in San Diego County, child suicide, as mentioned by Rady Hospital, Children's Hospital, homelessness, unemployment, and ruining our economy and our city for years to come, the onus is on you to show us that there is still an emergency. Perpetuating a false emergency just to get CARES or stimulus money is fraud. Under the California Emergency Services Act, a local emergency means the duly proclaimed existence of conditions of disaster or of extreme peril to the safety of persons and property within the limits of a county and so on, caused by such conditions, which are likely to be beyond the control of the services, personnel, equipment, and facilities of that subdivision. The governing body shall review the need for continuing the local emergency at least once every 30 days until the governing body terminates a local emergency. This law gives you authority to end the local emergency. For those of you who are new to the board, we've been showing the supervisors the data that there's no state of emergency for almost a year now, and they refuse to listen. So I hope those of you who are new will now show us the data that there is a state of emergency. The onus is on you. I'm a volunteer with Reopen San Diego. We have over 1,200 members. We're growing larger every day. Find out more at reopensd.org. Thank you.
Thank you. Our next speaker is 3644. 3644.
Hi, good morning. This is Leona S. Thank you for the opportunity to speak. I just wanted to say that lockdowns are illegal and you individuals are not God. You are equal to us and you work for us. In the United States of America, we are born with inalienable rights. They are God-given. Our rights are not given to us by the government, city council, the San Diego County Board of Supervisors, CDC, or anyone else, so they cannot be unlawfully taken away by these entities. We do not live under tiers or tyranny or tyrants. You all need to stand up for the Constitution. In addition to the Constitution, under California Civil Code 51, we are all free and equal. We are entitled to freedom. You are not the gatekeepers to our freedom. Our safety is not your responsibility by law or by virtue. You individuals are not discerning and have no clue how to analyze data. You just read scripts, take orders, and enforce them with no authority, which is the exact definition of tyranny. You all would do very well in China, Venezuela, Russia, etc., but you don't belong in America or in San Diego, and you certainly do not deserve any leadership role within our community. You are useless, ignorant, and your prideful arrogance is killing children, hopes, dreams, livelihoods, and our economy. Also, you have some nerve to claim racism as a public health crisis. You are all public health enemies and false idols. Speaking as a melanated or Black American and San Diego native myself, I can truly say you have ruined this city I love so much with your Marxist communist agenda. There is no state of emergency. You are gaslighting. There are no variants for a virus that has never been isolated. This vaccine is a fully experimental shot. You are lying by saying it keeps people safe, and you have zero proof to support this lie. We are not your lab rats. The only pandemic we face is one of fear and stupidity driven by you all, and the longer you keep up this charade, the more you expose yourself. We will never forget what you've done. The lockdown is over, and you are probably all finished in politics. It's really time to do the right thing now. Thank you, everyone.
Thank you. We have no remaining speakers on the line at this time, Chair Fletcher.
Thank you. Thank you for that. I appreciate the presentation. Look, we are headed in the right direction. Our case numbers continue to remain low. The number of vaccines continue to go up. And I want to particularly point out the efforts in San Diego to continue to be the leader in the state of California with number of vaccines administered per person for any large county. And it's a considerable effort. They're all over our county, all districts. I know all supervisors are involved in promoting those efforts in each of their districts. I want to pay particular mention to the efforts in the South region and our equity type programs that have been very difficult and challenging, but are beginning to show results in the work that is being done. Obviously, we're still hamstrung by the lack of availability of vaccines to meet the need and to meet the demand. And we are hopeful that those numbers will increase significantly. But we are seeing progress. We're seeing progress with the almost certain descending into the red tier. with the increase in vaccination, with the progress around a series of events. And so I think we're certainly headed in the right direction, which is very welcome news after an incredibly long year. With that, I'll make a motion to approve the recommendations in the COVID update, and we'll turn it over to some of my colleagues if they would like to make some comments. I have a motion and a second by Supervisor Anderson. Let me ask my colleagues if they have any comments on this item. Supervisor Desmond.
Thank you, Chair Fletcher. I appreciate the presentation by staff. Very thorough, very in-depth. Thank you so much. And I really appreciate all the efforts that everyone has put in. I had the opportunity yesterday to be in Oceanside to announce the opening of a new vaccination site up there in one of the Health Equity Index zip codes, and it was very well received. And I want to thank all the staff that's working up there in the Oceanside. I do have a comment, though, and I'll kind of put this under the unintended consequences category. You know, it's been great to see kids back out on the fields. You know, last Friday night, they're playing football, other sports throughout the county. But one of the things I have to mention in my office, is we've heard from quite a few people, is some disturbing videos and pictures coming out of parents not being able to watch their kids play. And, you know, this comes after an extremely difficult year with, you know, kids not being allowed in the classrooms and not being able to play sports. Now they're finally allowed to play. But what's happening is the school districts are not allowing parents to come onto the fields or in the bleachers or in the stands. And what the pictures were showing was lots of parents grouped up, you know, outside of cyclone fences or in the areas around the fields trying to watch their kids. And that was not, I think that's, you know, the unintended consequence of not allowing parents to potentially come inside the fields, maybe sit in the bleachers or in the stands, and social distancing. It's outdoors. I think it's very safe. So I know it's not up to the county, the school districts, but I would like to ask our staff, you know, when working with the school districts, if we can kind of alleviate these unintended consequences and maybe ask the school districts to allow people to sit indoors, you know, or in the stands, not indoors, but inside the perimeters instead of standing outside and being bunched up around the fences. I think being indoors in the stands, socially distanced, will be safer. So it's the only comment I have. Thank you very much for the presentation. I'll be supporting the item.
Thank you, Supervisor Desmond. Thank you for those comments. If we could ask if Gary is on hand to just clarify, because I understand your point that school districts are doing it, but I think we want to make clear for the record what the actual guidance is around observing and the ability of parents to observe their kids consistent with public health order. Something is with us.
Chair, Gary isn't in the chamber today, so perhaps Wilma can give an update.
Okay.
Per state guidance, parents are not allowed to congregate on the sidelines. The same goes for cheering, unless it's an actual competition. And the logic or strategy is just people gathering. We will take the concerns back to the state and determine if some alternative recommendations can be made. Thank you.
And Dr. Wooten, we should get clarity, because I was told by Gary Johnson that the state guidance allowed for parents to serve as an observer for their children at these events. So I think step one is we should probably get clarity, because I think we're sending some mixed messages about what the rules are.
Thank you.
Yeah, thank you, Chair. I appreciate the clarification, because I heard the same thing you did concerning that. So the clarification would be helpful. Thank you.
Yeah. Vice Chair Vargas.
Yes, thank you, Chair Fletcher. I just wanted to thank the county staff and team for their continued efforts. Particularly, I really am thrilled to hear that in South County, we've been able to actually vaccinate 94.3% of our 65 and older population. You know, it's this talk about a team effort between community, legislators, elected officials, our county staff, and the vaccination pods. They have really worked 211, all these different interventions. And so I really wanted to make sure that I said it on the record, because all of the work and the flexibility has really made a difference in the district, which has been the hardest hit, you know, and so I just wanted to say thank you to them. And then I also wanted to say that I really appreciate, we had our first workshop yesterday. I know at the last meeting, you know, I was asking if we could have community workshops. And I loved the workshop. I hope everybody takes advantage of this opportunity. We were able to create a system so that people can actually rank some of the issues that they cared more about in the community, and the top 5 priorities that the community brought up were rental assistance, food assistance, direct stimulus payments, childcare subsidies, and small business stimulus payments. And so I'm looking forward to hearing from everyone else and what other members of the community have to share. But I really did, I just think that this is the new way of doing things at the county, and I think it's real. I'm really grateful to the staff for that. Also, and I know, Chair Fletcher, you've been leading a lot of the efforts around behavioral health. I keep hearing from folks specifically around the issue of our youth. And I am really concerned about the fact that I met with the folks at Children's Hospital, and they were mentioning to me that 1 in 11 youth are suicidal before the pandemic, and now with the pandemic, it's estimated to be 1 in 9. And so these numbers are very alarming to me, and there's no doubt in my mind that recovery needs to include trauma-informed care, especially for our youth in our schools. They need to be supported. And so I wanted to bring this up today because I want to make sure that as we're thinking about what kind of support we want to put together as part of the framework, and I know there's been a lot of work that's been done, that we really think about particularly these issues. And overall, I just want to say again, thank you to everyone for all the hard work, and we're going to keep at it. We can see the light at the end of the tunnel. Thank you.
Yeah, thank you, Vice Chair Vargas. And I agree. One of the items we've been working on is some type of behavioral health screening and service programs for our youth as they reintegrate back into schools and they come back. And I think that is should be an important and targeted focus of our efforts as we consider the totality of the packages. So I completely agree with you on that. All right, I'm not seeing anyone else. We have a motion by myself, a second by Supervisor Anderson to adopt the record. Yes.
Mr. Chair, Gary Johnson has called in. He's in the Zoom, so he can answer your question. I think there is some clarification. Thank you.
Great.
Good morning, everyone. I was literally on a K through 12 sector call with about 600 different participants. So if the question can be repeated for me, I'd be happy to give it my best shot to answer it.
Yeah, Gary, we're looking for what is the guidance around observers for kids at youth sports activities for parents to be on site during their practices and games.
Yeah, it's definitely covered in the indoor-outdoor youth and adult recreational guidance, Chair, on page 3. But essentially, there is a limited observation of use. It's for ages 18 and younger. You can have basically immediate household members present for appropriate supervision. Obviously, if they're there, they would still need to be managing the physical distance requirements between households. They have to have their face coverings, things of that nature. I hope that answers the question. If there's a follow-up, I'm standing by.
No, just so Supervisor Desmond and I are clear, because there's been some confusion here. So immediate household members. So parents and household members can attend the sporting activities of youth 18 and under, provided they utilize a face covering and physically distance from households.
That is correct, and that is for practice and competitions.
All right, Supervisor Desmond.
Yeah, just Gary, thanks very much. So, I mean, would that allow in the stands? Because I think that's kind of the limiting factor here. I think people realize they have to social distance and do the mask thing. But they're being asked to come in and sit in the stands and do that social distancing, because right now, in several cases, they're having to be outside the fence, and there's not always enough opportunities, I guess, or places in the fence that for people to gather and still social distance. So I guess it's more about being able to sit in the stands or inside in the field, or adjacent to the field, as opposed to outside of the field.
Yes, sir, and I appreciate that point of view. It is a challenge, and this is kind of a challenge we see in a lot of different venues. And the guidance doesn't really give you any more specificity except to ensure the physical distance can be maintained. So I think I can take some kind of question up to the state, maybe get some clarification, more broader or more specific guidance. But that's what the guidance is. To the best of our ability, we've got to try to maintain those physical distancing requirements in between folks that are not of the same household. And that's just where we are right now based on what's black and white in the state guidance.
Okay, and I guess I'm just assuming from that to me, it sounds like they can sit in the stands as long as they're social distance, but it's district property, so there's maybe some issues there. But if we could encourage that sitting in the stands instead of gathering outside the fences where everybody's all bunched up, it's kind of the unintended consequence. Thank you.
But Gary, there's nothing written in the order that prohibits people from sitting in stands, provided household units are physically distanced from one another. Is that correct?
Yes, Chair, that's correct. The absolutely, I would recommend that they use, every, square, foot that they can to obviously meet the guidance and allow observers to be there to view our youth. So yes, they can use the stands, they can use areas around the stands, whatever it takes to try to get the distancing and facilitate observers is what all clubs, teams, schools should be trying to do.
And I think as we socialize that more, I was out safely observing with members of my household. My boys use sports activities this weekend, and they were definitely not allowing people to sit in the stands. And so everyone just had to spread out in the areas around there. And I think if that's not an actual requirement, it may be a legacy carryover for some previous iterations of where we were. But I think per your guidance, immediate household members, so folks who live with the youth, can attend practices and competition, and the household units just need to be physically distanced from one another, and that is the extent of the order. Okay.
That is correct, Chair.
Okay, thank you for that clarification. That's helpful. Supervisor Desmond, is that good? Good clarification?
Yes, thank you very much.
Okay, perfect. All right, with that, we have a motion by myself, a second by Supervisor Anderson to adopt the recommendations in agenda item 11. I will ask the clerk to call the roll.
Thank you. Supervisor Anderson?
Aye.
Supervisor Lawson-Remer?
Aye.
Supervisor Desmond?
Aye.
Vice Chair Vargas?
Vargas, aye.
Chair Fletcher?
Fletcher, aye.
That motion passes unanimously with all supervisors being present and voting aye.
Thank you, and thank you to all of our COVID staff and team for all of your hard work. We will now let you get back to work. We will carry on with agenda item 12, San Pasqual Academy. We're going to get a presentation from our child welfare staff. I know we're going to have a multitude of public speakers, and then I know board members will certainly want to provide input and comment on this item as well. I think this is a very difficult item. It is a very challenging situation and time. Certainly San Pasqual formed 20 years ago by this Board of Supervisors in response to the reality of some shortfalls in the foster care system 20 years ago. They responded to meet the need. And now we're in a situation where there's been significant changes in the last 2 decades about what's best for kids and what structure and what format and what is allowable. We've spent a fair amount of time. We've now had 3 separate public hearings on this item, both work groups of the Child and Family Strengthening Advisory Board, along with Vice Chair Vargas and myself, convening an entire Child and Family Strengthening Advisory Board meeting on this topic. And there is a lot of rightful heartbreak and frustration over the situation. There's also a fair amount of misinformation around what is happening or what is transpiring. And I think today will give us an opportunity to really understand the totality of the situation we face, and then really look at the options ahead of us for what we can do as we move forward. I think one of the most pivotal things that we all have to keep in mind is that state and federal statute governing the child welfare system, which is what provides the licensing, which is what makes the option real and legally compliant, has changed significantly in the past decade. And these changes all predate every one of us joining this Board of Supervisors and coming here. But a combination of changes of federal law, of state law, a 3-year extension that was granted to San Pasqual to prepare for the transition to come into compliance that was set to expire at the end of this calendar year, along with the early notification from the state of California that the San Pasqual Academy extension, which was believed to run through the end of the year, would be expiring in October, has put us in a place where we need to chart a path forward and a responsible path forward. And when we look at all of these options, I think paramount and foremost to all of these is the absolute care and love and nurturing environment that must be provided to every youth in our foster care system. Both all of those individuals that are presently at San Pasqual, along with the 98 to 99% of our foster youth who are not in San Pasqual. I think we care deeply about all of our foster youth and all want to come together to figure out what can we do that gives us the best path forward to make sure that we're doing what is best for all of our youth. Early on, I suggested that we request from the state a 9-month extension from the October date. That would get us through June of next year. It would allow a second graduating class along with more time to assess the options. We don't know. Our board is going to consider today if we want to formally request that extension. I think that is a wise and appropriate step. We don't know if the state will grant it. We don't know if the state can grant it. But that is certainly one path that we have to go through. But I think the culmination of the Family First Prevention Act, the federal law, which limits the ability to place people in congregate care setting, along with state licensure changes that have happened, combined with the declining number of youth in foster care and the significant decline in the number of youth at San Pasqual, has put us in a situation of needing to spend some serious time looking at how we can best work our way through there. I will say there's no disputing that San Pasqual Academy has had a tremendous impact on foster youth that have resided there. It has provided a safe environment. It's provided tremendous support for these youth who are fortunate to get a spot there and have given them a lifetime of success. And I know I've heard from a lot of alumni along with youth who are currently there. And so we want to make sure that we honor what has been done and figure out as a board every option we have for working our way through there. Again, we've had 3 public hearings on this item. Our board will consider it today. In April, it is agendized again for the Child and Family Strengthening Advisory Board. And I know that the items will be returning to this board again as we gain greater clarity over what is allowable, what is possible, and where we can go. And I just ask for all of us as we work through this to, again, continue to be mindful of the voices of the youth who are there. Have us all continue to be mindful of the challenges we face with changes in state and federal law. And again, remember that each and every one of us are very committed to the kids and foster youth and all want to see the very best possible for each of those who come into our care. So with that, let me turn it over to Kim Giardino, who's going to walk us through a presentation on some of the history of this issue, where we are, and some things to consider as we move forward, and then we'll hear from the public speakers.
Thank you, Chair Fletcher, and good morning to the members of our Board of Supervisors. Today I will be providing an update regarding San Pasqual Academy. San Pasqual Academy opened in 2001 and is a first-in-the-nation residential education campus designed to meet the unique needs of adolescent youth in foster care and to prepare them for self-sufficiency upon exiting care. At the time when San Pasqual opened, there were over 7,000 children in foster care in San Diego, many of whom were not placed in family settings. Youth exited care at the age of 18 since we did not have extended foster care or transitional housing programs at that time. Youth were often unprepared to live independently. The youth originally identified and placed at San Pasqual Academy were high school-age youth, unlikely to return home and in a long-term foster care situation. These youth did not require the intensive treatment of a higher-level group home. Instead, they needed a place to support them, even after they left the system. We are very appreciative to all of the advocates and supporters of San Pasqual who came together to develop a model that has improved outcomes for foster youth. San Pasqual has demonstrated positive outcomes, including a high graduation rate from high school, a high percentage of youth enrolling in post-secondary education, and maintaining ongoing support and connections for alumni. San Pasqual Academy has a licensed capacity for 184 youth, with a current population of 67 youth as of Friday, March 12th. San Pasqual is designed to be similar to a family home-based placement and serves as an alternative option for dependents of the juvenile court 12 to 17 years old and non-minor dependents up to the age of 19 years. Through a unique partnership of public and private agencies, including New Alternatives, San Diego County Office of Education, Access, Inc. through the support of the San Diego Workforce Partnership, the Friends of San Pasqual Academy, and the County of San Diego, youth are provided with a seamless delivery of residential, education, work readiness, and child welfare case management services. Collaborative and comprehensive services and supports provided at San Pasqual include individualized education on campus for 9th through 12th graders, independent living skills training, health, wellness, and therapeutic services, work readiness training, extracurricular and enrichment activities, and family connections and permanent support systems. Additionally, San Pasqual Academy provides youth with relational supports during their stay at San Pasqual and post-graduation through the San Pasqual Academy Neighbors Grandparents Program and Alumni Services. The Neighbors Program consists of volunteers living on campus who develop natural relationships with the youth, offering mentoring and life skills opportunities. The Alumni Services offered by New Alternatives, Inc. allow alumni to return home from college during holidays and school breaks, as well as receive support during times of crisis. San Pasqual was designed to improve the outcomes of youth exiting foster care who were unprepared for independence by providing a long-term placement in an independent living skills environment so youth could focus on completing their high school education. It was a place intended to provide stability, structure, and support for youth in foster care. Over the past 10 years, there are 3 pieces of legislation that have impacted changes to the child welfare system and the use of foster care. California Assembly Bill 12 created our extended foster care program. California Assembly Bill 403 began continuum of care reform efforts, and federal legislation called the Family First Prevention Services Act aims to improve prevention services to prevent youth from entering foster care. Assembly Bill 12 was signed into law on September 30th, 2010, and took effect on January 1st, 2012. AB 12 implemented provisions of the Federal Fostering Connections to Success and Increasing Adoptions Act of 2008 to improve outcomes for youth in foster care. One of the things that AB 12 did was create California's extended foster care program, which allows eligible youth in child welfare and probation to remain in foster care until the age of 21. Youth may leave extended foster care and later choose to re-enter up until the age of 21. As a result, over 90% of San Diego youth opt in to extended foster care, providing them more support with education, work readiness, transitional housing, and supportive services. The Cal Youth Study, which has been evaluating California's implementation of AB 12, shows that for every additional year in extended foster care, youth significantly increase the probability of completing high school or gaining their credential. It increases the expected probability for youth enrolling in college, significantly decreases the amount of money youth receive in need-based public food assistance, decreases the odds of youth being homeless or couch surfing, decreases the odds that youth may become pregnant or parenting, and decreases the odds that youth are arrested and convicted. On October 11, 2015, Assembly Bill 403, also known as the Continuum of Care Reform Act, was signed into law. Continuum of Care Reform, or CCR, provides the policy and statutory framework to ensure that services and supports for children and youth and their families are tailored toward the ultimate goal of maintaining a stable family. Drawing upon a body of research that shows that youth who suffer from abuse and neglect do best when they can live in a supportive, home-based family environment, CCR identifies home-based settings with resource families and relatives as the best placement option for youth and limits a youth placement in congregate care settings to a new licensing category called short-term residential therapeutic programs. Youth in an STRTP can maintain a placement there no longer than 6 months in order to receive intensive treatment to transition to a home-based setting. Youth must also meet medical necessity for specialty mental health services, and the Interagency Placement Committee must approve the placement of the child in an STRTP. While San Pasqual Academy is licensed by the California Community Care Licensing Division as a group home, the distinctive services offered set the program apart from other licensed congregate care facilities. Continuum of Care Reform included language to help preserve San Pasqual and recognizes that the program, though licensed as a group home, was built around a residential educational environment that promotes independence and self-sufficiency while focusing on completing high school, preparing for the world of work, practicing independent living skills, and developing relational permanency. As a result of multiple discussions on how to preserve this unique program as permitted through the parameters of continuum of care reform, an updated program statement for a 3-year pilot project for the period of December 1st, 2018 through December 31st, 2021 was approved by the California Department of Social Services on August 17th, 2018. Subsequently, a memorandum of understanding between the California Department of Social Services and the County of San Diego outlined how San Pasqual Academy will promote the principles of continuum of care reform and solidified SPA's continued operation. The MOU codifies that San Pasqual remains licensed as a group home. The Family First Prevention Services Act passed in 2018 and was enacted in 2019. States could choose to begin implementing in 2019 or could take up to 2 years to delay and plan for implementation. California opted for the 2-year delayed implementation. However, all states are required to implement the Family First Prevention Services Act by October 1st, 2021. The Family First Prevention Services Act provides new funding for mental health, substance abuse, in-home parenting, and kinship navigation services to prevent children from entering or re-entering foster care. It also provides new requirements for reducing the use of congregate care settings and providing increased supports for youth to live with families. New congregate care requirements under Family First outline 4 types of congregate care settings: a qualified residential treatment program, a setting specialized in providing prenatal, postpartum, or parenting supports for youth. In the case of a child who has attained 18 years of age, a supervised setting in which the child is living independently, or a setting providing high-quality residential care and supportive services to children and youth who have been found to be or at risk of becoming sex trafficking victims. The Qualified Residential Treatment Program is very similar to what we have already established in California with our short-term residential therapeutic programs. These programs must use a trauma-informed treatment model, have licensed nursing and clinical staff available, and facilitate the participation of family members in the child's treatment. They must also provide discharge planning and family-based aftercare for at least 6 months and be licensed and accredited. For children to be placed in a qualified residential treatment program, children must receive an assessment from a qualified professional within 30 days of their placement. The assessment must specify in writing the reasons why the needs of the child cannot be met by the family of the child or in a foster family home. And if the assessment finds that placement in a QRTP is inappropriate, the child must be transitioned to another placement within 30 days. The Family First Prevention Services Act also limits the number of children that may be cared for in a foster family home to 6 or a child care institution to 25. As a result of these statutory and other practice changes focused on keeping children with their families and preventing child maltreatment, Child Welfare Services has experienced a 67% decrease in the number of children in foster care over the past 19 years, from over 6,700 children in foster care to just over 2,200 currently. Additionally, through the continuum of care reform, San Diego has experienced a 69% reduction in the use of congregate care just in the past 10 years. As of January 1st, 2021, child welfare data reflects that only 216 of 2,238 children remain in congregate care settings. At that time in January, 72 were at San Pasqual Academy, 47 were at the Polinsky Children's Center, our 10-day assessment center, and 97 were in short-term residential therapeutic programs. With the changes in the overall number of kids in foster care and placing more children with families, there has been a 47% decrease in the population at San Pasqual Academy since the high in 2008. Over the last 10 years, San Pasqual Academy has tried to accommodate the changing needs of our foster care population by considering youth in middle school to allow sibling groups to remain intact, youth in active family reunification cases, youth in dual status cases, those who are being served both by child welfare and juvenile probation, youth with low-level offenses active to probation, and youth from neighboring counties. Additionally, Child Welfare Services sends a list every month to staff of potentially eligible youth for staff to evaluate if a referral to San Pasqual would benefit the youth. Even with these efforts, the number of youth placed at San Pasqual Academy has declined. The campus has shifted with more youth in active family reunification cases who are transitioning home or to relative placements, contributing to shorter lengths of stay, which is a shift from the original San Pasqual model. This data shows the number of referrals that have been made to San Pasqual Academy since continuum of care reform began. As you can see, 573 referrals have been made. Please note that this is a duplicated number of referrals, as some youth may be referred more than once. Just over 1/3 of those referrals are accepted for placement, and after being accepted, about 75% of youth are placed. Please also note this does not include referrals from probation or other counties. On February 8th, 2021, Child Welfare Services was notified by the California Department of Social Services that the San Pasqual Academy 3-year pilot project would terminate effective October 1st, 2021, rather than December 31st, 2021. And without this MOU, San Pasqual Academy is an unlicensed facility, and youth cannot be placed in an unlicensed facility. As of October 1st, 2021, the beginning of the federal fiscal year, there will no longer be federal Title IV funding authority to operate San Pasqual Academy because it is not recognized as a family setting, nor does it meet the requirements to be a therapeutic placement setting outlined in the new Family First requirements. Title IV federal funding covers approximately 14% of the San Pasqual Academy budget, and the county would need to invest approximately $1.4 million additional realignment funds to cover lost Title IV federal revenue from October 1st, 2021 through June 30th, 2022. Based on the positive outcomes demonstrated by youth placed at San Pasqual and our alumni, and the input received from community partners and stakeholders, Child Welfare Services is seeking authority from the Board of Supervisors to request an extension from the California Department of Social Services to allow San Pasqual Academy to continue operating through June 30th, 2022. If approved, this extension will provide Child Welfare the opportunity to continue to engage youth and partners to explore other models that may extend the successful outcomes of San Pasqual to a wider foster youth population and support mindful and trauma-informed transitions of our youth at SPA to suitable placements with minimal impacts. If the board approves the recommendation to make a request for an extension, Child Welfare Services will work with the CAO's office to ensure that request is made quickly. Child Welfare Services has hosted 2 public meetings just this week and will continue to engage with youth and stakeholders regarding potential alternative options for San Pasqual Academy, as well as ways to further strengthen supports for all youth in foster care. San Pasqual Academy has benefited many youth, and with additional supports, we can help to ensure that all foster youth have improved outcomes similar to those who have been placed at SPA. Most importantly, we will also be working with the youth who are currently placed at San Pasqual to develop individual trauma-informed transition plans for new placements for whenever those youth may need to move. Thank you for the time to share this update. This concludes the presentation, and I'm available for any questions.
Thank you. Why don't we hear from our public speakers, and then I know that there will be probably a fair number of board members who have questions, Kim. So definitely stick around. Let me ask the clerk to call forward our public speakers, and then we'll come back for board deliberation.
Thank you, Chair Fletcher. I'll note for the record that we received 107 e-comments on this item. We have 27 requests to speak on this item. Any members of the public that have requested to speak on item 12, please dial into the conference line now using the instructions that were provided to you. We will be calling speakers by the last 4 digits of their phone number. You'll hear a notification that your call has been unmuted. You will then need to press *6 to unmute your phone. Each caller will be asked to state their name for the audio record, and you'll have 2 minutes to address the board. You'll hear this sound when your time is up, so please conclude your comments at that time. I would remind the public speakers that they should mute their TV or live video stream before they begin speaking. Erin, if you could please identify the first caller.
Thank you. Our first caller is 0447.
Good morning, Chair and speakers. My name is Phil Decter. I'm Director of Child Welfare for a national research organization called Evident Change that has had the honor to partner with Child Welfare Services in San Diego for many years. I will be brief. I'd like to start by acknowledging and congratulating San Pasqual Academy staff, supporters, alumni, and in particular the youth that are placed there and that have been placed there historically. By all accounts, it has been a model program and they are to be congratulated for the good work that they have done. I also cannot underestimate the loss that those staff, supporters, and alumni and current youth are currently feeling. It can't be minimized. At the same time, I do want to lift up the fact that the direction of the California legislature that Director Giardina has mentioned around continuum of care reform, the federal legislation with the Family First Prevention Services Act, are all well supported by child welfare research. Nationally, congregate care does not have terrific outcomes. Young adults who leave group care are less successful than their peers in family foster care. Youth with one group home or congregate care placement are at almost 2.5 times more likely to become delinquent or homeless than their peers in foster care. And youth in congregate care are more likely to drop out of school and less likely to graduate high school. This is not meant in any way to be a slight on the good work of San Pasqual. It is just to give some context to the direction that's happening both nationally and in California. I am in strong favor of the motion the board is considering today. I think that it would serve San Pasqual and Child Welfare Services well to get the opportunity to let the current seniors finish their year and say goodbye appropriately. I also think it gives Child Welfare Services more time to understand what were the successes of San Pasqual and how to bring that to the rest of the family foster care community. Thank you.
Thank you. Our next speaker is 9112. 9112. Please press *6 to unmute yourself.
Oh, okay. Good morning. Is it still morning? Yes, this is Marie Cohen from Washington, D.C., and I'm a little confused by this whole process. I didn't recognize my name being my number. But anyway, my name is Marie Cohen, and I write about foster care for Child Welfare Monitor, an online publication read by child welfare practitioners around the country. I'm here to support the extension of the San Pasqual Academy pilot project until June 2022. When we remove a child from his or her home, we take on a moral responsibility. It is not enough to place the child, often without his or her siblings, in an indifferent foster home where they receive, if they are lucky, enough to eat and a place to sleep, where contact between home and school may be non-existent. Yes, there are some amazing foster parents for whom foster care is a calling, not a source of money to pay the bills, but they are few and far between. No, when we take a child away from their family, we owe them so much more than room and board and indifference. We owe them what they get at San Pasqual Academy, homes where siblings can live together, small classes with caring teachers, house parents who have a calling to nurture foster youth, foster grandparents on campus, extracurricular activities for every interest, including sports teams, mental and physical health services, and all the extras that make for a normal high school experience, from Christmas parties to prom dresses, all funded by the Friends of San Pasqual Academy. And all this enrichment gets results. According to an evaluation published in a prestigious youth services journal, of the youth who were at least 18 years old when discharged from the academy, 92% graduated with a high school diploma or GED, which greatly exceeds the rate not only for foster youth, but for all California youth. In fact, the evaluator stated, "We are not aware of any other program serving foster youth in the United States with such high rates of high school diploma and GED completion." I know there's some confusion about what can and cannot be done under state and federal law, but as the last, am I still on? As the last speaker
has expired, ma'am.
Okay, thank you.
Thank you. Our next speaker is 9261. 9261.
Hi, can you hear me?
Yes, hello.
Hi, my name is Cecilia. I'm an alumni from San Pasqual Academy. So I'm actually on just in support of extending San Pasqual Academy until June 22nd. As an alumni and a former foster youth, and not speaking bad about foster homes, but foster homes aren't for everyone. I wasn't looking to replace my family. I wasn't looking to replace my mom. I was looking for a placement, well, a group home, but more of a family that I can develop on my own terms, that I can go to, that will support me and my trauma, that will help me overcome my trauma, that will be there for me as a family that I've chosen. And foster homes just didn't provide that. I was placed in numerous foster homes throughout San Diego County. Being split up and removed from my siblings wasn't for me. I was the second oldest, but I was the caretaker of my siblings. So having us split up, it did tremendous trauma to my brothers and sisters that were in foster homes, that were abused in foster homes, that were neglected in foster homes. And San Pasqual offered us to all stay together, and it offered us a place to feel safe and comforted. And the closure of San Pasqual Academy is it'll be detrimental. It's going to ruin the lives of current and former or future foster youth. So again, I support extending San Pasqual Academy until June 22nd and beyond, June 2020 and beyond.
Thank you. Our next speaker is 8688. 8688. Please press *6 to unmute yourself.
Hello, this is Catherine Rhodes, and thank you for bringing this forward. And I very much agree with your recommendation to try to keep it open and ask for an extension. For myself, I have a couple of questions from staff. There's a whole bunch of different numbers, it says, of how much it actually costs to run the school. San Diego Union Tribune did an article where the county says it costs $14 million, with 34% or $4.76 million coming from the federal government. But in this documentation that you had, I think it was $1 million something coming from the federal government. So one of the things I want to know is exactly how much money does it actually cost to run the school, for the teachers, for the Board of Education, for everything. I don't really think it's that much money. So that was one of my first questions. And then, of course, there's always solutions, even in state law. If you don't want to have it be public, you could change it into a private school. And when you do a private school, there's a whole bunch of other alternatives that you can have besides having a pilot project. So there's so many different solutions. If there's a will, there's a way. If you actually wanted it open, you could have it open. There's so many different types of funding streams. But one of the main things is, to get away from, does it really cost $14 million a year to run it? I don't believe so. And it would be good to actually get the actual numbers. I tried to look it up at the county website, and I couldn't figure out how much money does it actually cost. What does the county actually pay from its general fund or from other funds for this? And of course, there's always solutions if you want them. Thank you so much. Bye.
Thank you. Our next speaker is 4557. 4557.
My name is Debbie Syverson, and I am calling in support of the extension for San Pasqual Academy. As the 2017 San Diego Grand Jury Report summary stated, and I quote, "One of the goals of the San Diego County Board of Supervisors in founding San Pasqual Academy was to provide foster care children a stable, caring home for those who could not return to their parents or their guardians. The Academy is a proven success. The grand jury found the San Diego County Board of Supervisors made a sound investment of taxpayers' dollars in the Academy. San Pasqual Academy returns this investment by producing productive citizens and taxpayers. The grand jury recommends San Pasqual Academy be fully utilized to better serve children who have been abused or neglected. Please follow the grand jury's recommendation and extend the Academy and increase its utilization for foster youth. And as a reminder that was stated by our first speaker, there are still over 2,000 foster children in San Diego County, many middle schoolers, many high schoolers that could benefit from being at San Pasqual Academy. Thank you.
Thank you. Our next speaker is 7662. 7662.
Thank you, Chair Fletcher and members of the board. My name is Maddie Kilkenny, and I'm honored to serve as Supervisor Desmond's representative on the Child and Family Strengthening Board. My desire to serve has a lot to do with San Pasqual Academy. It's a place that is near and dear to my heart. I was there the day it opened, and I remember fondly helping the kids pick their mascot, the Dragons. When we started San Pasqual, it was with the sole purpose to take care of the children that through no fault of their own could not be reunited with their parents. 20 years later, we know that SPA has worked for so many. It has done everything we talked about it doing. Kids get to be kids. They sneak out of their rooms and make out in the orange groves. They graduate high school and they form lifelong bonds. But the system has changed. And so now we as a county and a community must also change and remember that original purpose today and start to rethink our mission. There are 67 children at SPA right now, 67 kids and hundreds of alumni for which SPA is a home, a safe and nurturing place to live where they're surrounded by loving, supportive adults. It's not just another placement. So let's do what's best for those 67 kids and the alumni. I wholeheartedly support applying for the waiver, but even then, we as a county and a community have to be honest about the fact that our beloved San Pasqual Academy is no longer the long-term solution we hoped it would be. We must also acknowledge the uncertainty and fear that all of this is causing to the remaining kids, staff, and alumni. And we must be honest with them. To move a foster child is all too painful for so many kids in our care. It adds layers of trauma, mistrust, and fear. We must face that head on with and for the kids, because that's what we would do for our own kids. We must start engaging the kids in the planning of their own future, because again, that's what we would do for our own kids. And we must start thinking about what they and all foster children need to live happy and productive lives. I want to thank Kim Giardina and her staff. They're clearly committed to doing what is necessary and best for the remaining kids and alumni at SPA. And today I'm asking you to do the same. It was the Board of Supervisors and so many others who created change 20 years ago. And this board can do that again. Thank you.
Thank you. Our next speaker is 0369. 0369.
Thank you. My name is Lois Jones. Thank you to the Board of Supervisors for hearing me. Over the last few weeks, you've heard from people all over San Diego pleading with you to keep San Pasqual Academy open for the foster team and to perpetuate the very successful program that has helped our most precious population, our children. You now are asked to prove you truly care about these young people by filing a request to the state to delay the closing of the academy. Please support that effort. But even more important, we urge you to concurrently move forward with making the academy a permanent program for foster youth. These young people need to know their security and safety are in place and will be there for them in the future. They don't have the safety net that our own children enjoy as they venture into the adult world seeking their path for their future. They need to know they are supported, safe, and have that safety net. San Pasqual Academy is the home they depend upon. The community here is their family, their friends, their support system. Please don't remove from them that very important element of their life. Your words that say you care need to be followed up with your action. Please keep San Pasqual Academy open in perpetuity. Thank you.
Thank you. Our next speaker is 3115. 3115.
Hello, my name is Justine Hess-Thomas. I'm a former foster youth and alumni of 2006, and I am calling in with the People Association of Justice Advocates in the support of item number 12. Please support this agenda item, which will request the state of California to partner with the county to extend San Pasqual Academy closure till June 2020. We believe San Pasqual or SPA should continue in existence after 2020, and removing it would continue to build more mistrust among the foster youth population of the officials who claim they have their best interests at heart. Our county must invest in all requests and resources that help our foster youth. SPA is a village, and it takes a village to raise a child. Please, in San Pasqual, please invest in San Pasqual's future and fight to carve it out in the state's laws. As a village, our foster youth can go for many years to come. Let's reimagine foster care together. Thank you, and I hope that we can keep San Pasqual Academy open.
Thank you. Our next speaker is 2670. 2670.
Good morning, Board of Supervisors. My name is Simone Hids Monroe, former foster youth and proud alumni of San Pasqual Academy. My request is for each of you to vote in favor of the extension of San Pasqual Academy. You have a responsibility to care for and protect the children in your county, especially the youth in foster care. Although there is a decline of youth in foster care, there remains to be thousands of children in San Diego's foster care system. The reality, not all youth, particularly teenagers and sibling sets, fit the options of reunification, adoption, or foster homes. Not due to their own wrongdoing, but as a consequence they must endure. I myself was one of these children, the youngest of 4 siblings, 4 teenagers whose mother, their only parent, suddenly passed away due to medical issues. The first day in foster care, at the age of 13, I was told by my social worker there was an almost 0% chance I would grow up with my siblings. This social worker determined the best plan was for me to be adopted, my brothers put in a boys' home, and my sister, who was 16, to get placed anywhere, given she would only be in care for 2 years. This was devastating news. Our mother raised us to take care of each other and to stick together. I am sure lessons you yourself were taught and instill in your own children. As devastating as this news was for me years ago, it remains to be a reality for many youth in foster care today and will be the fate of many youth at SPA if an extension is not supported. A dedicated effort to strengthen the community approach to raising children in foster care must be explored. The community approach at SPA nurtured me and my siblings into the loved, successful, and strong adults and leaders we are today. As a community, we need time to partner, including with experts who are the current and former foster youth, to work together in being solution-driven and determining what's best for our current, future, and alumni foster youth. Thank you.
Thank you. Our next speaker is 5639. 5639.
Hi, my name is Kelly Davis. Thank you for allowing me to speak. As the wife of an emergency room physician at Scripps Mercy Hospital, my family is on the front lines of serving the marginalized. We understand firsthand how important it is to support foster children in our community. Federal and state laws can be amended, and enrollment at San Pasqual will go up if Child Welfare Services understands SPA can maintain its licensing. We need to rethink how we can keep San Pasqual open. We are just starting to see the light at the end of the tunnel of a global pandemic, and I think it's safe to say that we will be in need of SPA in the future. Thank you.
Thank you. Our next speaker is 7522. 7522.
Good morning, supervisors. My name is Corinne Campbell. I am here this morning representing the Seroptimus International Club of North San Diego to support the extension to June 2022 of San Pasqual Academy. We have been awarding continuing education scholarships to the graduating seniors at the Academy for the last 6 years. As part of this process, we ask for applications from the students. Part of this process includes information on the history of each applicant and what their wishes and desires are for their future. We then personally interview these applicants. It has been an awakening by all of our members of the horrors faced by children placed in the foster care system. Some of them have been in and out of home-based foster care for far too many years. Every single one of them credits the Academy with their success and their salvation. These young adults are poised, articulate, intelligent, and appreciative of the incredible opportunity they have had to be a part of San Pasqual Academy, where they live in family-type settings with caring adults who help them focus on the future and the success of their lives awaiting them. Every single year, we go back to our board and members and ask for more money to give to more students because they are so impressive. We need more of these successful young adults in society, not the broken, incredibly damaged children who all too often come out of home-based foster care settings, where there is no daily accountability for adults in their lives who are paid to take care of them. They miss out on after-school activities because the foster home has too many children. The program at SPA is unparalleled in the country. It has been held up as an exemplar of possibilities for foster teams who can't make it in a traditional program. There has to be an alternative for these children. The streets can't be their safety. They are so desperate, they actually think it is a better option than the cruel homes they often come from. No mistake, some of the adults who care for foster teens are amazing people.
Your time is
But they
up,
even,
but
okay, thank you for speaking.
so much. Our next speaker is 2501. 2501. Please press *6 to unmute yourself. And if we don't hear from you and your number is called, we will come back to you. Our next speaker is 0874. 0874.
Hi, I am Joan Scott, a volunteer with Friends of San Pasqual Academy. Recently, you have heard firsthand about the effect San Pasqual has had on the lives of our foster kids. Remarks such as, "It saved my life. I was able to remain with my siblings. It has protected me from people that were supposed to care for me. It rescued me from traumatic abuse and neglect. After 12 placements, I finally had a stable place to call home. San Pasqual is my family, my community," on and on. Well, County Board of Supervisors, you are who your actions are. Only one of you has toured the campus after it was announced in the newspaper article that it was closing. Thank you, Supervisor Desmond, for taking the time and learning about this unique home and school firsthand. You took action. As a Child and Family Strengthening Committee meeting, our foster kids and alumni told us heart-wrenching stories of abuse and neglect under the county's care and foster placement. Many were very emotional in sharing their personal stories. It was noted that Supervisor Fletcher had his camera turned off for over an hour while these kids spoke. It wasn't until Simone Monroe called attention to his rudeness that he finally turned his camera back on. This was insulting to our foster kids, and his actions show the disregard, uncaring, and unprofessional attitude for our foster kids. Again, you are who your actions are, not words. San Pasqual Academy is not a group home. It is unique, and our leaders need to fight to keep it open permanently. They need to be proactive and not reactive. They are in a position to keep it open and yet keep blaming state and federal officials. There are currently 2,200 foster kids in the system. When our foster kids are removed or not allowed to go to SPA in the future, are kids going to be placed in a school with a 94% graduation rate? Move only one time? Are they going to be cared for after graduation? Use common sense and be the voice of reason. Quit blaming others and show good leadership. Do the right thing and fight to keep San Pasqual Academy open. Thank you.
Your time has expired. Thank you. Our next speaker is 2501. 2501. And again, if we don't hear from you and your number is called, we will come back to you. Our next speaker is 3042. 3042. 3042, you may proceed. You may be muted on your end.
Hi, this is Doug Jensen. And for all the reasons stated earlier, I support your action proposed to extend the date of closure, but not just till next year, but forever. The Academy does so much more than a single foster family can provide to kids, especially when it comes to having the flexibility to have siblings live together. And I've seen lots of graduates and their success. And please, please take a look at this closely and fight real hard with the state to make sure that they do not close this. In fact, they should be opening more like this facility throughout our nation. Thank you.
Thank you. Our next speaker is 3200. 3200.
Hi there, can you hear me?
Yes, hello.
Hi there, my name is Susan Jensen and I go by Pia. Thank you to the Board of Supervisors. I'm calling to support of San Pasqual Academy. My comments are based on personal experience with SPA. Staff and volunteers have truly created a loving, supportive family environment to an underdeserved, vulnerable group of young adults removed from their homes through no fault of their own. A football game where our sons, now 30 and 31, our son's team played opposite of the young men at SPA was my first introduction to the passionate support provided to the students of SPA. The positive energy displayed by the students, staff, and volunteers through their happy, vociferous cheers struck me as an amazing demonstration of community support and uplifting encouragement to players who may have never felt that before. Honestly, this was the first instance where I didn't mind if our son's team lost. Since then, I've had the opportunity to volunteer at various activities and fundraisers that support the students at the SPA. Holiday parties, including gifts for the students and back-to-school events where students can select donated materials and clothing to get them ready for an upcoming school year, are just a couple of fun activities that give the students a sense of normalcy. I'm not sure that this kind of care would be found with individual foster families that may or may not provide this level of care. SPA is a safe haven where students feel like they're part of a family. They support one another and receive an abundance of support from the staff and volunteers. They are prepared to succeed in life and encouraged to strive toward a college education. They are supported through this process and always have a home to return to during vacations. I'm struck by the thoughtful, articulate words of the SPA alumni and have to believe that SPA was a big part of them having the courage to speak out for what is right. We urge you to consider to keep SPA open and use it as the model for the state's children's congregate foster care services rather than be closed. Thank you so much for hearing me.
Thank you. Our next speaker is 2081. 2081. 2081, please press *6 to unmute yourself.
Hi, this is Don Wells. I'm the CEO of Just in Time for Foster Youth, and I wanted to speak to both the current students at San Pasqual and the future. Back in 2010, my daughter on purpose graduated from San Pasqual, so I'm very aware of the full picture of the academy. I first met Belen and her brother 20 years ago when she was only 8, just before they both went into the foster care system for the 3rd or 4th time. They can never remember that exact number. I managed to stay in their lives at that time, and one day as we watched a movie together when Belen was 11, she turned to me and asked a question that gave me a moment of lasting clarity. She asked me, "Why are you still here?" Because at that moment, our 3-year connection was the longest continuous adult relationship she'd ever had. And I said to myself that no young person should ever have to ask themselves why we are still in their lives. I carry that insight with me when I pushed for Belen to enter San Pasqual, and I carried it with me when I joined Just in Time as the executive director the same year Belen graduated from SPA. Over the years, Just in Time has built a community of support for young people, and that included a lot of SPA graduates and staff who were from San Pasqual, And it's built on the idea that relationships and lasting connection is an essential, basic need for young people, just like food and shelter. And that's why, despite our best intentions, any plans or solutions for the future that ignore that truth are doomed to fail these young people. The young people at San Pasqual should know now that there's a whole community that will still support them no matter what happens in the future, extension or not, a long extension or a short one. They need to know there are people there. So I ask that organizations like Just in Time, Promises to Kids, Voices for Children, Children Legal Services, and others who share the dreams of these young people be invited to meet with them as soon as possible to give them reassurance that the question they're asking, who will still be here for me, can be answered to them directly. Thank you.
Thank you. Our next speaker is 0053. 0053.
Good morning. My name's Terry Summerhays, and I am requesting that you find the solutions and join the efforts to save SPA permanently. This school has provided stability and support to countless graduates and alumni over its 20 years of successful operation. Stories of alumni attest to the experiences which gave them a better start to life than any other placement ever would or could. The recent UC Davis study, which was done in 2020, concludes, quote, based on the data collected to date, our findings support the conclusion that the Academy is a model program for adolescents and emerging adults transitioning from foster care. End quote. I repeat, model program. There's a 92% high school graduation rate. Isn't that what we want? I plead with you to listen to the voices of the alumni and the current students at SPA. They are the experts. They are living it and have lived it. SPA is a residential school. Recognize the benefits. Carve out the exception to recategorize SPA as a residential school that it is. Put the lives of these young people on a path to success. If you haven't had a chance to tour SPA, please do so. And thank you, Supervisor Desmond, for doing just that. It is an exemplary collaboration of public funds and millions of dollars donated from generous donors exclusively to provide the betterment of the lives of our foster youth. It's a vibrant community of caring adults, house parents, teachers, social workers, and the entire staff working to support these deserving youth. The grandparent program of senior citizens living on campus is exemplary. Another layer of support. It's a win-win. I've been a supporter of SPA for the past 18 plus years, and I have personally witnessed the results of this extraordinary program. They can remain in one safe, beautiful, nurturing place, receiving all the services that they need. They form connections and make lifelong friends. They can catch up on their academics. With the trust and the hope that they have learned there, they break generations of youth. Well, I ask you, use your courage and your hope and find the solution. It's the right thing to do. It works.
Thank you. Our next speaker is 9364. 9364.
Thank you. This is Michelle Krug. I strongly recommend that, hope that you will be supporting this move. I'm going to adopt that motto of please have San Pasqual Academy continue in perpetuity. This is an amazing facility that does what nowhere else in San Diego County does. I was that kid. I left home at 12. I literally had to, on the streets, figure out adult by adult, child by child, creating my chosen family, but without any options of guidance. San Pasqual Academy, I visited it several times and spoken to many of the youth there over the last 10 years. And they feel like the foster system, one size does not fit all. And we can't assume foster homes are not for every kid. So I just really applaud that you're doing this as a temporary solution, but please create it so that this stands in perpetuity, because these kids need an option, and that option is an amazing one. And all of its successes, the woman from Washington, D.C. said it better than I could possibly say it. So please say yes today and say yes for the future.
Thank you. Our next speaker is 5192. 5192. Please press *6 to unmute yourself.
Hello, my name is Reverend Shane Harris, and I'm the president of the People's Association of Justice Advocates, as well as a former foster youth of 13 years in San Diego County and a former student of San Pasqual Academy. Over the last few years, the PAJ has been a leading national civil rights organization fighting to close the disproportionate gap of Black children within the foster care system. At the age of 16, I was placed at SPA. When I was taken out of a foster home because of negligence and abuse, SPA was the only place I could go because I had no foster family wanted to take in an older youth. Several studies have been done showing large amounts of referrals of Black and other children of color to our foster care systems nationally. In San Diego County, Black youth make up 20% of the foster care system, showing they are disproportionately referred into a system that is often not culturally competent and failing to be trauma-informed. We submitted a petition to the clerk of the Board of Supervisors, over 506 signatures from county residents in support of the extension and my reimagining foster care proposal to address inequities within the system. At San Pasqual Academy, 48% of the youth are African American, nearly 20% are Latino, 9% are LGBTQIA. There are 21 sibling sets, which is what SPA is most known for, keeping siblings together. Those youth who live on SPA's campus should not have found out that they will lose their home in the media, Chair Fletcher, when they were entitled to know when you and the board knew. I wonder how much actually has changed about our system. Thank you, Helen Robbins-Myers, for bringing this forth today. Thank you, Supervisor Desmond, for recently touring campus with us, and Child Welfare Services official Felisa Bullock, who joined us as well. A good start for our county government today would be to hear the overwhelming cry of the 70 foster youth living on that campus, alumni and stakeholders across our region who have voiced their support for reimagining foster care in San Diego County, starting with San Pasqual Academy. Vote to request the extension from state officials to keep SPA open through June 2022, and even more so, fight to reimagine foster care by bringing former students, former foster youth, current foster youth, and stakeholders together to address the inequities within our foster care system. SPA is a village, and it takes a village to raise a child. Thank you.
Thank you. Our next speaker is 2776. 2776.
Dear County Board of Supervisors, hello. My name is Suzanne Hume, and I'm the Educational Director and founder of CleanEarthForKids.org. Please grant San Pasqual an extension through June 2022 and find ways to continue providing support for these foster care students. This is a model program at San Pasqual Academy. Foster care youth need our support. Often, these foster youth have had to move from home to home in situations that are less than ideal. Graduates from San Pasqual Academy credit most of their success to the fact that they attended this academy. San Pasqual Academy has almost twice the number of students who graduate from high school and 10 times the number of students completing college as compared to other foster youth. San Pasqual has phenomenal statistics. As has been stated, there is a real need to keep this open, and emotions are running high. Of course, can you imagine not knowing where you are going to live or having a stable home? Thousands of children are in foster care in San Diego. Please grant San Pasqual this extension and make San Pasqual a pilot. San Pasqual is a unique situation and has shown extremely positive statistics. Let's think about how we can support these foster youth. Thank you so much.
Thank you. Our next speaker is 1436. 1436.
Hello, my name is Beth Hyde, and I'm calling to request that you guys look at not only extending the closure to 2022, but also to do a carve out
in the state law. San Pasqual Academy is not just a community. We are a family. We have residential staff, which include house parents. We have teachers, clinicians, county social workers, grandparents, peers, and alumni that are all here to help support and nurture the foster youth on campus. We are missing the mark when we have a student here whose sister had to come visit from Polinsky because the referrals were stopped on February 22nd. The sister asked if she could come, and she was told no, and that they were separated. That is the action due to the Child Welfare Service. That is not what San Pasqual's Academy is about. We are about keeping families together. We are about growing and healing as a whole family. I am asking that you guys please look at other options for that carve out, and I thank all the alumni who have come forward to say their story and all the current students who have been so brave in sharing their story and their fight to save their home at SPA. Thank you.
Thank you. Our next speaker is 8923. 8923. Please press *6 to unmute yourself. And if we don't hear from you when your number is called, we'll come back to you. Our next speaker is 5607. 5607.
Hello, my name is Yvette Romero, and I am calling today to vote in favor to extend the pilot program for San Pasqual Academy. I attended San Pasqual Academy, but I did not graduate. I picked up the pieces from not graduating, and I had to work really, really hard to get to where I am now, but I've made it. I recently completed my second residency at San Pasqual Academy, teaching and encouraging youth to write and express themselves, as I am a successful published author. I also encourage current youth to learn from the mistakes I've made in the foster care system. Not too long ago, we were here listening to a story about KDA/Pathways to Wellbeing. When I first heard about the KDA lawsuit, I wanted in on the lawsuit. Foster youth were leaving foster care without the adequate and essential mental health to cope with their childhood trauma. I am asking to extend San Pasqual Academy, and to improve the long-term future of SPA, I am asking to reimagine San Pasqual Academy. Thank you.
Thank you. Our next speaker is 7739. 7739. Please press *6 to unmute yourself. And if not, the only remaining speakers on this item are 8923 and 7739. So if you'd like to address the board on item 12, please press *6 to unmute yourself. Again, the phone numbers are 7739 and 8923. Chair Fletcher, we're not seeing any activity from those two callers, so that appears to conclude public testimony on this item.
Great, thank you to all of our callers who called in. Let me go to my colleagues for any comments or questions they may have of staff. Let's start with Supervisor Desmond.
Thank you, Chair Fletcher. I guess I have, first of all, a question for you. Has the Child and Family Strengthening Advisory Board taken a position on, I guess, the longevity of the SPA? In other words, I'm assuming they're in favor of the extension, and you and the subcommittee, you and Supervisor Vargas. But I was just curious if they've taken a position on it should shut down or should not shut down, or have not taken a position on that yet.
No, they have not taken a position on that. We didn't hear from many of the members of the advisory board today, but I think there's general support for requesting an extension. I think that there is a general acknowledgement on the part of most of the folks who work in this field that federal law and state law have changed significantly in the last 2 decades. And it's just a different world in terms of how the foster care system works. in general. So, but no, it didn't come up to have us take a position on that.
Well, I'd like to make a couple comments then as a follow-up. So thank you. I just wasn't sure if there was a position taken. So as was mentioned, I did visit the Academy last week, and I got to tell you, I hadn't been out there before, and I know many of you have been out there before, but I was just in the last week I went, and I was really moved by the care that is given there and the amount of good that comes out of the San Pasqual Academy. You know, I'm actually in favor of the extension that's before us today, but I would like to see us have the option of keeping it open beyond the extension for foster youth. And, I'm against shutting it down specifically for that foster youth purpose. I understand the laws have changed. I understand that the congregate care facilities are not in favor anymore with the state or with the federal government. But this is unique. SPA is unique. And this is a beautiful campus with homes and classrooms and sports facilities, and even parents and grandparents who live on the campus. It's a residential education program. It's a special place with around-the-clock services such as mental health. There's a clinic on site for emotional support, for education, and for recreation. And it's still, even though it's declining in numbers, it's still a very valuable tool in the toolbox, I think, for foster kids. I'm not sure what the minimum number is for the viability of the academy. I don't know that that's been established or not. I understand it's lower than it was before, but I'm not really sure that this is a number where it should be shut down at. But I think that it caters to a very vulnerable population under our care as a county. I've heard from some graduates and their personal stories, and some from many foster kids. The county's funding and support of the programs like the San Pasqual Academy is our only hope. And to have it fulfilling a life that many older foster youth seems very challenged to find. It's very challenging to place teenagers into foster youth homes, and this San Pasqual Academy is an answer for that. And one of the students there I had a chance to speak with, who actually came back and was working in the kitchen, where they also have job training on site there. But one thing she told me was the fact that what's special about the SPA to her and to many of her friends was that when you go into a foster care family, sometimes you're the odd person out. You're the odd kid out. And they don't always feel, even though they are loved, I'm sure, by many of the foster parents, but having that kind of separate status within the families. We're here at the academy, they're with their peers. They're with other kids who have gone through similar experiences, and it makes for a more conducive learning environment for them to achieve for themselves and to really kind of fulfill their potential. So that was really striking to me. I get that foster parent placement is the best thing for many kids, but this is a special place and a tool in the toolbox that may not get at other homes. So what's before us today is the extension, which I'm in favor of, and I'm glad to support the extension. And what's before us is not really the closure or what to do, or we're not really voting on whether to close it down or not. I would, at a later point in time, whether this extension is granted or not, have that option to keep it open. And to have that option to keep it open, we need licensing. So I guess I would like to, I'll go ahead and make a motion to accept staff's recommendation for the extension till June of 2022. But I also want to get a little more specific and to explore all the different options. And Kim did a great job in her presentation about explaining different options and things they can look at. But I think we really specifically, I would like to direct the CAO and the Child Welfare Services Director to take every possible action with the state and federal officials to get a permanent carve out for the San Pasqual Academy and come back through the subcommittee and the advisory board to the board with a carve out and other possible options, as was stated in the board letter. So I would like to see that they enlist foster youth, foster parents, San Pasqual Foundation members, service providers, and other partners as needed for this push to get this done. So we've got a short time frame, a short window, maybe only till October. So I'd like to have staff, our CAO and Child Welfare Services, in addition to looking at the options, to specifically include in that option going and getting the licensing, so we have the option of keeping it open further and beyond the either October 2019 or the June 22 potential deadline.
Thank you. Supervisor Desmond, can you just restate your motion for me?
Okay. Well, to direct the CAO and the Child Welfare Services Director to take every possible action with the state and federal officials to get a permanent licensing carve-out at Pasqual Academy, along with the other options that they'll be exploring.
Okay.
And that's the motion, but I don't know if we need to make it part of the motion, but to enlist foster youth, foster parents, and other people, and the advisory committee all through this, and then bring it back to the board, hopefully in a time where we've got ample time to make a decision on what we do in the next steps. Thank you.
All right, so we have a motion by Supervisor Desmond to receive the update, to direct the CAO to request an extension for the San Pasqual pilot from the California Department of Social Services through June 30th, 2020, to additionally a third recommendation to be added to the two that were there, direct the CAO and Child Welfare Services directed to take every possible action with state and federal government to get a permanent license carve out for San Pasqual Academy. And the fourth one would be to enlist Foster Youth Advisory Board and others in this process considering options. Is that correct, Supervisor Desmond?
That was beautiful. Thank you.
So I have a question, but I'm not sure before I make, is this the right time to ask the question? I know that.
Yeah, let's just see, let's read it. So we just have a motion. We're just gonna let it sit for 1 second until we see if we get a second, and then we'll do a couple questions, but we do have a motion there. Supervisor Vargas?
Okay, so first and foremost, I just want to say thank you to everyone who has not only provided feedback today, and I've been getting a lot of information from different folks, but also I think as a member of the Child and Family Strength Advisory Board, last week we had an opportunity to listen from, hear firsthand from our current and former foster youth from San Pasqual Academy as well. And then, yesterday I also visited another location that directly works with foster youth and some of the kids from probation as well. And so I've been really thinking about this issue and trying to figure out, I support the extension. And the only reason why I haven't made a second motion to Supervisor Jim Desmond's recommendation is that what I would like us to do is really actually have a conversation about really the foster youth at the county, right? A bigger conversation about, there are kids that how do they transition and I don't know. I'm just not ready to say let's just go ahead and open it up. Right. Let's keep this one open forever. I do support the 2-year extension, but I would like to find a way to really work with our foster youth community and with our social workers to better understand what are the other recommendations that are available for housing, and what can we do as a county in terms of partnerships with also nonprofits and other organizations that are also working in this arena. And so that's the only reason why I'm not seconding the motion, Supervisor Desmond, because I'm not ready to say let's just keep it open. I rather use the 2 years to really have to really think and do a deep dive. Maybe like what we did, like the workshop that we did around probation. Maybe we could do the same with foster youth, foster care, and listen firsthand. I know that I'm going to be hosting a roundtable with foster youth in our communities to better understand from them. And get feedback, because to me it's really important to come up with some solutions, and I'm just not comfortable with saying let's just keep it open. I feel more comfortable saying let's do the extension, and then let's do the hard work, take a deep dive, work with everyone, all the stakeholders, and figure out what the next steps are.
If I could comment, Chair Fletcher, my motion was the not to decide, yes, we're going to stay it open. But what I want to do is have, if we do decide to stay it open, to keep it open, that we have that we have dealt with the licensing issue. I mean, we can still have that, and I agree with it. We should still have that open discussion. We should, Supervisor Vargas, we should have that open discussion. We should still have maybe a workshop and things like that. I'm just asking to also go ahead with the licensing process so that we have that option to keep it open, as opposed to coming up or having that option on the table. So when we do make that decision, because if we don't pursue the licensing, that option won't be there. I'm not proposing that we keep, that we have it stay open. I'm just saying, let's go for the licensing, and so that we can make that choice.
Your motion is to have us see if we could change federal and state law to allow this type of operation to continue to exist.
Yeah, or carve out to that effect, yes.
Yeah, would take federal and state legislation. So that's why you have state and federal in there on the carve out.
Yes. So. Yeah. And that's only to go make sure we're going through that process and have the option to keep it open if that's what we choose.
And if that's successful.
Yes, yeah.
All right, Supervisor Lawson-Remer.
Thank you so much. So I just would thank you so much to everyone who came and testified. I was very saddened when I first read in the paper that San Pasqual Academy was going to close. It has had a generational impact in our community. And I know many foster youth have benefited from this program and call the academy their home. It sounds like we've been placed in a difficult situation by the changes in funding and policy on both the state and federal levels. So I actually had a couple of questions that I have a couple more thoughts and comments, but before moving through those, I just wanted to ask a couple of questions, if I may, to County Council to really get greater clarity on the actual situation that we face. So if that's all right, Chair Fletcher, could I run through a couple questions for County Council?
Yes, of course.
Great, thank you so much. So this is directed to our County Council. The first question is, my understanding is that the question is whether, as given that San Pasqual Academy is a foster youth facility, which government entity regulates these facilities and has the ability to determine whether they stay open or closed?
Supervisor Lawson-Remer, members of the Board of Supervisors, the California Department of Social Services Community Care Licensing Division regulates facilities for foster youth.
Okay. And which government entity has the authority to extend San Pasqual Academy's ability to operate? Because that's obviously the core question that we're facing today.
So the facility must be licensed by Community Care Licensing Division that I just referenced in order for the foster youth to continue to be there. In fact, two sections of the Health and Safety Code, sections 1508 and 1503.5, make it illegal to operate an unlicensed facility. Further, if it is to be funded by federal dollars, that would require a legislative change at the federal level to adjust the Title IV.
Got it. Okay, so then you sort of answered, but not completely, but just to be really clear, do we here in San Diego County have the ability to override the state and federal laws and independently allow San Pasqual Academy to continue operating?
No, we do not.
We don't? Okay, just to be very clear. Okay, thank you very much. I appreciate that. Because obviously this is a really sad situation. And that's certainly why I support requesting the state grant a 9-month extension of the license. Because to me, we must not only talk with those most affected by this, but also listen and actively engage with foster youth, because this is their program and these are their lives. And I want to do everything in our power to empower them to develop and influence solutions to the problems that they identify. So I will be supporting the grant of a 9-month extension, and very much appreciate your clarification on the legal challenges that we face in terms of state and federal law, having tied our hands here at the county. Thank you.
Thank you. Supervisor Anderson?
I want to make sure I got my hand down. I'd like to second the motion. having that information in our back pocket will only help us make better decisions moving forward. At the end of the day, if the state doesn't allow it, if the feds don't allow it, we're not going to be able to move forward. However, being prepared to move forward is a good thing. So I'll second that motion.
Thank you. Thank you, Supervisor Anderson. We have a motion from Supervisor Desmond, a second by Supervisor Anderson to adopt recommendations 1 and 2 in item 12, adding recommendation 3, directing the Chief Administrative Officer and Child Welfare Services Director to take every possible action with state and federal officials to gain a permanent license carve-out for San Pasqual and enlist Foster Youth Advisory Board and others in the process of considering options. I first went to San Pasqual well over a decade ago. When I was elected in 2008 to the State Assembly, it was in the district I represented, and I went early in my tenure as a member of the State Assembly. I went multiple times, and I saw the good work that was being done there, and was very proud of what had been done, and it certainly has been highlighted time and again for the results that it has generated. Right after being elected as a county supervisor, I returned to San Pasqual for a graduation ceremony, and again was struck by the feel of the students who were graduating and the encouragement and excitement they had. But I was also struck by how few students there were compared to a decade previously. I met with a lot of folks involved in San Pasqual and tried to better understand why there was such a decline in the number of folks who were there. I spent time diving into why such a high number of those referred by probation and public defenders and child welfare were being rejected. I even went to Los Angeles, where I met with county supervisors and staff in Los Angeles, and this was the first time I really became aware of this fundamental change that had taken place in the time since I left the legislature and came back to the Board of Supervisors around child welfare. And I remember in Los Angeles saying, hey, we have this facility and it has these great outcomes. Maybe you have some foster youth that would be a good match. And they looked at me like, you can't do that. You can't, no, we would not do that. That's inconsistent with federal law. That's inconsistent with best practices. That's inconsistent with state law. Like you're not, I don't know how that works. And I think that was really the first time I really grasped and began to understand the fundamental sea change that has been brought about in the child welfare system. And the importance that we all have in having a system that works for all of our foster youth. I will say I've made this a very high priority. I campaigned on this issue. This issue is a personal issue, a deeply personal issue to my family, to myself, to my mom, to so many others. This issue of foster care, we last year created the Child and Family Strengthening Advisory Board to have the most robust body of experts, including former foster youth anywhere. We have considered board letter and board action after board action to beef up and strengthen our child welfare. We've brought in our new director. We've added more social workers than any time. We've done considerable work. And I will tell you, it's good to have this robust a discussion on foster care. But as a board, I want us to have this robust a discussion about foster care, not only for this, but for the 99% of kids in foster care who don't go to San Pasqual. Because we have a commitment to every single child in our foster care system, every one of them. And there are ideas and programs and educational support and college scholarships and efforts that we ought to be doing system-wide and enterprise-wide. And I really appreciate Supervisor Vargas making that point, that we need to not only address what is in front of us with San Pasqual, but we need to have the same commitment, focus, and attention on all of the efforts that we have around our foster care program. And so I'm going to support the motion that's here today. I think initially I had early said, hey, we should get a 9-month extension if we can. We don't know if they're going to be able to grant that or not. We can explore changes, but I will tell you, and I just want us to all be realistic here, it is an incredibly unlikely scenario that both the federal and state government will fundamentally change their entire approach to foster care. I think that is incredibly unlikely. And you know, one of the public speakers really talked about the purpose behind San Pasqual is to provide love and care and nurture and best outcomes for kids in foster youth. And that purpose is not under attack. That purpose of caring deeply for our foster kids is not. We may have to reconfigure buildings, we may have to transition programs, but a promise was made to foster youth, and that promise we can find a way to fulfill. And so as we explore those options, a part of those options have to be preparing, if it is not successful in getting state and federal law changed, how do we ensure that promise? And how do we ensure that we remain united in that purpose of caring for every single foster care continues throughout this? And if we do that, then I think we will be fulfilling our obligation to take care of all of those kids in our custody. So with that, we have a motion by Supervisor Desmond, a second by Supervisor Anderson. Let me ask my colleagues if they have any final comments. If not, not seeing any.
I do want to say something, Chair Fletcher, because I think you said it, but I want to reiterate it. I'm going to support the motion, but I don't know how else to say this. I really get nervous about creating expectations for the public and for our foster youth, and then not being able to meet what that the federal and state government, I'm not sure is going to be able to change really quickly. So I'll support it because I do want to support the extension, but I'll continue to work with yourself and the rest of our county team to make sure that we address other solutions.
Yeah, thank you, Supervisor Vargas. Supervisor Wasserman, your hand's up. Is that from before?
From before, sorry.
Okay, perfect. All right, with that, we have a motion and a second. Let's call the roll.
Thank you. Supervisor Anderson?
Aye.
Supervisor Lawson-Remer?
Aye.
Supervisor Desmond?
Aye.
Vice Chair Vargas?
Vargas, aye.
Chair Fletcher?
Fletcher, aye.
That motion passes unanimously with all supervisors being present and voting aye.
With that, we're going to break for lunch. We will reconvene at 1 p.m. and pick up our agenda in agenda order for the duration of the day. Thank you all.